Good morning, everyone. I'm County Executive Laura Curran. Thank you very much for joining us for our daily briefing on coronavirus COVID-19 this morning. I have with me our Commissioner of Health for the Nassau County Health Department, Dr. Larry Eisenstein, Commissioner of the Office of Consumer Affairs, Gregory May, and we also have some leaders in education with us this morning. Dr. Jermaine Williams, who is President of Nassau Community College, Dr. Kishore Kuncham, who is Superintendent of Freeport Schools, Bill Johnson, Dr. Bill Johnson, who is Superintendent of Rockville Central School District, and Dr. Robert Dillon, who is the Superintendent of Nassau BOCES. So we're going to be dividing this into three parts today. We're going to talk about numbers, we're going to talk about new violations for price gouging, and then we're going to talk about protocols and procedures and what's happening in our world of education, K-12, and also our colleges and universities. So as of this morning, we have 25 positive cases of the COVID-19 coronavirus. That is 6 new since yesterday. Those are divided up this way. We have 20 in the town of Hempstead, 3 in the town of Oyster Bay, 2 in the town of North Hempstead. We currently have 153 residents in mandatory quarantine, 79 residents in precautionary quarantine. We currently have 10 tests pending. So as we get the news, we will report to you. Our Department of Health, the County Department of Health, is working very closely with the State Department of Health to continue to investigate any possible cases based off of these new cases that we're announcing today. So as we have said before, when we have a new confirmed case, we have disease investigators who begin a contact investigation, and they go through the contacts of the person who is confirmed positive. Where do they work? If they have children, where do they go to school? How do they get to work? Have they traveled on mass transit recently? So that if we have others who are deemed at risk, who are close contacts with these positive cases, we will contact them directly and let them know how to proceed. I had the opportunity to tour Northwell Health Labs early this morning in Lake Success. They came online to test a couple of days ago, and they're going to be announcing soon that they're ramping up more expedited testing. We do know that the more we test, it's very likely the more positive cases that we will have. So I really need to emphasize right now that panic and stress do not help us solve problems. We want to make sure that we're giving the public the facts. So I think it's time for us all to take a deep breath, maybe take some breaks from social media, and arm yourself with the facts. And I think the most important fact, the most empowering fact, is that containing community spread is vital. We're doing that through our contact investigations. We have a health department that is 200 strong and has been doing an outstanding job working around the clock. We have a very well-prepared Office of Emergency Management that has the right kinds of trucks and vehicles for transporting people should we need that. Our school districts, and we have 56 school districts here in Nassau County, along with a lot of private schools. They are all preparing for tele-teaching should the need arise. We've heard announcements about some school closures, especially in connection to the 2 school bus drivers who tested positive that we spoke about yesterday. All 80, the families of all of the 80 children who, by the way, who rode those buses have been contacted. So we're doing everything we can. Our IT department, the police department, OEM, health department, of course, the communications office is doing everything we can to get the word out about what we're doing and how we're partnering with our local, other municipal leaders, our towns, our villages, our cities, working with the state, and of course with the federal government. I also want to tell everyone what you can do. I don't know, you could probably repeat this along with me right now, but if you're not feeling well, stay home. Don't go to the doctor. Don't walk in to the walk-in urgent care. Call. If you're feeling ill, if you have shortness of breath, cough, fever, if you have symptoms, please call. We're not shaking hands right now. It's not impolite. It's just the right thing to do right now. We want to make sure that people aren't taking advantage of this panic and the stress and the anxiety right now. And so we have a very robust Office of Consumer Affairs that is really clamping down and doing investigations. So we announced 2 violations yesterday. This morning we're announcing 7 additional violations, and a total of 15 price gouging investigations are happening as we speak. A couple, I'll give you an example of some of the new ones that we're talking about this morning, some of the new 7 violations. Convenience store in Carl Place was fined $5,000 for selling Purell at a too high price, at a very high price. Gas station in Great Neck fined $5,000 for selling $3 hand sanitizer for $10 each. A card store in Hicksville was fined $5,000 for selling 7-Eleven branded hand sanitizer for $13, a small bottle. Manhasset Pharmacy and Variety Store was fined $10,000 for selling hand sanitizer at a highly inflated price. Syosset Card Store fined $5,000 for selling masks individually, and these should not be sold individually. You don't know who's touched them, for about $16 each. And a Wantagh convenience store was fined $5,000, again, for selling masks individually and not collecting the sales tax on them. Again, to report price gouging to us, to our Office of Consumer Affairs, email pricegouging@nassaucountiny.gov, and Greg May and his team will be on top of it. So the main thing we want to talk about today, shifting gears, is about schools. I have kids in public school, in a middle school and a high school. I understand the concern that parents have firsthand. I hear it from my neighbors as well. As you know, there have been several school districts, private schools as well, colleges and universities that have temporarily closed this week. This is not to cause panic. This is to contain the virus, as we are talking about, to prevent community spread as best as we and as best as the school districts can. We continue to work closely with our school districts to assure our students and faculty and staff members are safe. Yesterday, we announced that the 2 new positive cases were bus drivers. We've already covered that for both public and private schools, and those schools decided to close temporarily. There is a collaborative effort in the decision to close a school between the school districts or the private school, the Nassau County Department of Health, and the New York State Department of Health to make decisions on how to proceed. So if there is a link between a positive test and any of our school buildings, this collaborative effort happens to then provide guidance on how to proceed. Many of the schools that have temporarily closed in Nassau County are independently making that decision because of connections to a positive case, and that is absolutely their prerogative. They can do that. And if they feel that is the right thing to do, then they absolutely should do that. Our school representatives who are here now will discuss more protocol and precautions that they are taking, including plans for continuity of education if a district or a college has to close for an extended period of time. Teleteaching, for instance, I know my kids in our school district, our local school district, teachers are taking a survey of the kids, asking if they have a connection to Wi-Fi, if they have a proper kind of device, and making sure everyone's connected to Google Classroom. That's just one example of many. We are hoping that all of these measures will just be having to be taken under an abundance of caution, and we want to reassure everyone who lives in Nassau County, who teaches in Nassau County, who goes to school in Nassau County, that we're doing everything possible and beyond to make sure that we are safe, and our kids are safe, and our teachers are safe, and our school janitors and school nurses, that everyone remains as safe as possible to contain the spread of coronavirus. Most important, take care of yourself. If you're not feeling well, we love you, but please stay home. We'll see you when you get better. Thank you very much. And I would like to now turn it over to our educators to speak. So this is Bob Dillon from BOCES.
Good morning. I'd just like to assure everyone, as Laura said, that we're doing everything in the school community. Our superintendents, our leadership at the building levels have stepped up. We're deep cleaning buildings. We're sanitizing buildings. We're also planning for the continuity of instruction. We at BOCES have tremendous technical capacity with the internet. We will be meeting, we have met, we will continue to meet with our district leaders to share with them what we're doing and how we can increase their capacity or provide the capacity so they can deliver instruction to our students. Thank you very much.
Thank you.
Can you all identify yourselves as you speak, please?
Bob Dillon, District Superintendent, Nassau BOCES.
Thank you.
Yeah.
Jermaine Williams, President, Nassau Community College. Good morning. Thank you, County Executive, for inviting us to participate this morning. Thank you for Commissioner of Department of Health. You've been extremely helpful with your guidance. As we are all aware, the COVID-19 situation is ever evolving and causing an abundance of concern throughout the country and definitely right here in Nassau County. Among our NCAC community, our students, faculty, and staff are our #1 priority, and we've been extensively monitoring this rapidly evolving COVID-19 situation. Staying in close communication with our county and state officials and updating the NCC community regularly through emails and a dedicated page on our website. Upon notification from the Department of Health yesterday that we had our first confirmed positive association with the virus, we made the decision to close the campus through Wednesday, March 11th, today, in order to clean the campus according to appropriate guidelines. Face-to-face classes are suspended through the end of this week, Friday the 13th. Online classes will continue, and staff have been asked to return to the campus tomorrow upon the completion of the cleaning. All buildings on the campus will be thoroughly cleaned following Center for Disease Control guidelines and utilizing the Environmental Protection Agency registered disinfectant. Additional detail will be paid to specific locations where we know the positive individual has visited. In addition, we have chosen to postpone and/or cancel certain NCC-sponsored events or campus gatherings through April in an abundance of caution. As you can imagine, events are a fabric of our institution, and a lot of hard work and time is spent in producing these gatherings. However, to continue to ensure the health and safety of our NCC community, this step needed to be taken. Our executive and incident command teams have been in extensive contingency efforts to ensure business and educational continuity in the event that the campus needs to move operations remote for a prolonged period of time. We will continue to work closely with the County Executive's Office, state officials to assess the college's COVID-19 situation and determine when we can resume normal operations. We are thankful for the external and internal partnerships with union leaders and other college constituencies as we forge forward knowing that health and safety is our paramount concern. We will take whatever measures necessary to ensure their safety and health. Thank you all for your time.
Thank you very much, Dr. Williams, and I want to thank you and your college's cooperation with my administration and with Dr. Larry Eisenstein, our Commissioner of Health, and his entire team, and also with BOCES and our other school districts. The communication between our institutions is incredibly important, so I'm grateful for that. Dr. Bill Johnson from Rockville Center School District.
Thank you, Laura. Just very briefly, I think I want to emphasize a few points. One, this is a community problem, and what you must understand is how closely we have been working with both the county and the county health department in fact, containing the problems that we have within our school district. Just to follow up on a few things that Bob Dillon had mentioned just a few moments ago, we're looking at this in terms of layers, and at the very beginning of this, what we need to do is have two priorities. The first is safety, the second is education. On the issue of safety, when in fact anything in our school district would suggest that we have either a student or a faculty member or a member of our staff who has in fact been identified positively, we have gotten guidance from the state that we will close immediately. The purpose of that closure immediately for 24 hours is to do two things. One of them is to clean our buildings, and the second is to conduct an investigation with the health department. We're also preparing for long-term plans. There is a possibility that we may end up closing for 2 weeks or more. And in the event that we're doing that, what we have done is work with our teachers, work with our principals and our administrators on putting together plans that enable us to provide electronic connections with our families in the community. We are putting together and assembling all of the instruments that they would need at home. We are also working on things that I never really thought of before, things like hotspots. Not everybody in our community or in the communities in Nassau County have access to Wi-Fi, so what we need to do is to figure out ways in which we enable them to connect with us and maintain that continuity of learning. So you need to know that most of the teachers in Nassau County have been provided time within their school districts to work with their administrators on assembling either units of instruction or lessons that can either be sent home in envelopes and in folders, or in fact, as in our case, will in all probability be sent home as part of a plan for utilizing, in our case, we're going to be using iPads. What's interesting is that there are many things. We don't have to reinvent the wheel on this. As some of you may or may not know, you can go on YouTube. You can access things like the Khan Academy. And many of our teachers, rather than in fact being encouraged to try to develop lessons on their own, to visit the websites, find things that would be compatible with what they're doing in the classroom, utilize things effectively to provide some continuity of instruction, some continuity of learning. So I could go into lots more detail. I may if you would like to ask questions, but at this point, you need to know and have confidence that the school district in Nassau County understand the dimensions of this problem, are working with our county leaders and, in fact, with our health department in resolving this issue, and we're very confident that the children, although it may not be exactly the education that you can expect, will have some degree of continuity of instruction in their family, with their families and in their homes. Thank you very much.
Thank you very much, Dr. Johnson. Would you like to speak? Yeah? Dr. Quincham from Freeport Schools.
So, good morning, everyone. Thank you for having us here. Most certainly, I echo with everything that has been said. Not to repeat things that have been already said. That's on our minds, and the schools are ready for anything that we have in front of us. The first thing I want to really talk about is really rumors. I think that something is happening. I can just tell you, like even last night in Freeport, there was a rumor about a situation that we had to deal with. So what I would urge everyone, not only, of course, Freeport, but whoever is hearing, listening to us, to really exercise responsibility relating to rumors, social media, and verify facts, information from verified sources. Reach out to the schools for appropriate information. So I urge the parents, students to exercise caution in times like this and seek the right information from right people. So I'd like to say something beyond. Dr. Johnson started talking about e-learning. That's something we have been doing for a long period of time. Most districts across the state, now, like your safety plans, where you do a lot of tabletop exercises, this time is allowing for our e-learning plan to be tested, be effective. So a few things I might want to touch on is really, I know it's being done by a lot of districts, but including Freeport, we are creating a resource sites on our websites where students can go to log in to all the digital resources that they already have access to, but you're going to find one place for them to have all those resources that can that are currently supporting our instructional plan and currently supporting the learning of our students. So we are going to make that made available in one single place. And as Dr. Johnson said, our district certainly is ready, and we have over 6,000 Chromebooks that our students have already. The Google Classrooms are in place, but now just the location is going to be changing. Instead of being in the schools, teachers, other support staff working with our students remotely. We are testing in all the login credentials, important information regarding the programs. Staff is working sure, and again, I'm repeating a few things. Yes, those who may not have internet connection or a computer, or somebody not having their electrical cords for their computers. Those things are all being ironed out. You know, there's tons of digital resources that we have, and we're very confident in the event of short-term closing or long-term closing. Most certainly, learning will continue, and I'm also very happy to say that the entire staff, not only in Freeport, in other districts, are concerned and willing to work with all of us to provide that continuity of learning and education from wherever they are. And those conversations continue, and we're taking every day that's available, every hour that we have, to make sure whatever gaps we have in order to address the concerns that we have, they are being very effectively addressed. Thank you.
Thank you very much, Dr. Kuncham. I would like to underscore what he said about rumors. Rumors are flying fast and furious in the schoolyard, in the social media world. Don't believe everything that you hear. Oftentimes it's not true. So we want to do our best. That's why we're doing these daily briefings, just to get you the information, to get you the numbers as we're getting them. So thank you. I want to really thank our educational leaders for taking time. I know you're very busy right now, but for taking time to inform the public. We're grateful that you came, and we're grateful for what you do every day for our kids. Happy to take any questions you might have.
I just want to verify those numbers for Talmadge. Those are the towns of Hempstead, town of Elizabeth Bay, town of North Hempstead, right?
Yes, yes. Did I not say that? Yes, 20, yep. Those are the actual towns, right?
Yes. This may be more of a question for the health commissioner, but how many test kits do we currently have in Nassau County, and is there a shortage?
My understanding now is that we have the capacity to test what we need to, and the capacity is growing all the time. We were very excited that Northwell got approval with the help of the state and the support of County Executive Curran to push the FDA to provide them approval. And we even hear that commercial labs may be going online very shortly. So far, we're not in a position where we have heard of a backlog where there's a lot of people who need to be tested that are not. And I do want to re-emphasize that there's still a criteria for testing. And if somebody does meet the criteria to be tested, they're going to be put in a mandatory quarantine until that test result comes back. We don't want frivolous testing. There needs to be a suspicion for it, and at this point, we have not heard that there's an inability to do that.
And you may not have specific numbers, but are you talking there's now thousands of test kits, or hundreds, or what are we?
Oh, I don't know how many there are, but I know we're meeting the demand right now.
Out of the 25 patients, is anyone in critical condition?
I believe there is one, and we'll get you an update on that, and that's a more of a recent occurrence, and the overwhelming majority of them are doing well.
Are all 25 at the hospital? Or
No, it's split up.
how many are there?
I don't know, and I want to inform you that the latest number that came in, it was at 19, happened as we were already here, so haven't actually reviewed the charts yet. We're going to really take the time to investigate them and get you that answer. The overwhelming majority of them are not hospitalized. I can tell you of the 19 that we had coming into this morning, 6 were hospitalized, the rest were not.
And the one that is in critical today, the age of that patient, gender?
I don't know, this is a recent occurrence.
Just to get back to the testing kits again, so if somebody wants to be tested, is that an option, or you're talking about prioritizing?
Yeah, somebody on the street who says, I want to be tested, there has to be a reason for them to be tested. And so the criteria has evolved and changed very quickly, very often. And so recently, the idea was to allow physicians in the community to start making the decision on who can and can't be tested. But the state gave the physicians very clear and strict guidance on what qualifies. So what we don't want is just random people going in and perhaps backlogging a lab. The issue may not be how many test kits there are, it could be how many can a lab process. And right now, it's Northwell and it's Wadsworth at Albany. The state laboratory is called Wadsworth in Albany. Until we have more labs and more capacity, that's going to be the bigger issue. And I know Northwell was talking about how with each day they're growing their capacity, growing the medium and all of that. So I'm not the lab expert, but as of now, people who the medical community has felt should be tested, we've been able to keep up with that.
As for social distancing, do you think at this time schools altogether should
All right, I'll give you the medical view on that first. So we really are looking at it on a case-by-case basis. And first, let me share some good news, because with these stories, there's a lot of fear and there's a lot of panic. A couple of days ago, I did a literature search and reached out to some colleagues, and there are no, and this is great news, important for you to know, no documented cases of pediatric deaths from coronavirus anywhere yet. Now, might that happen? Might we find more as more cases happen? I'm not saying it will never happen, but it's really good news that children are doing well, and that's very different than some other viruses like the flu, which we know can be very dangerous. So the thing about social distancing is you really have to weigh the risks and the benefits. You have to look at the evidence. One of the challenges with closing schools is, okay, now the kids are not at school, but where are they? And are parents home to take care of them? What's the impact if a parent can't go to work? And are parents going to be able to stay just home with their kid? Or are there going to be play dates and trips to the movies and the mall? Well, at that point, the exposure is beyond even just the school district. But so there is a lot to think about. And social distancing is a very important strategy for preventing the spread of disease. The worst thing that could happen is we keep kids home from school and then they go spend the day at grandma's house and could potentially bring the virus to them. So social distancing has to be done with guidance and correctly for it to be effective. Certainly, the key piece of social distancing is for people who are at risk to avoid risk. And so people who know that they are at risk should start thinking about what they're exposing themselves to. And that's a slightly different message, and we've been talking about it. But as it comes to schools, we're working with the schools to make a proper decision. And might there come a point when something broader has to happen? Maybe. But as one of the superintendents mentioned before, it is a layered approach.
You know, to reiterate what Laura said, we're trying to avoid panic, and this is going to sound a little bit like an oxymoron, create a climate of normalcy in this abnormal situation. It's uncharted waters, but as I said earlier, we have great teachers, great leaders, and we're working on this and planning and preparing for what we have to do. The idea of childcare is very important. The idea of nutrition is very important. Many of the students who come to our schools, the only meals they get may be the breakfast and lunch that we provide. So I know there's some direction in the state plan, but again, the practicality of it is still in question. But we're looking to create as normal environment as we possibly can, given the fluid situation that seems to change on an hourly, if not an hourly basis, certainly day by day. 2 weeks ago was certainly different than today, and we're planning for, as best we can with the information that we have, valid information, plans and programs for tomorrow. Thank you.
Yeah, of course.
I'm not in a position to actually decide whether or not all the schools in Nassau are closed, but I just wanted to address an issue with regard to something that Dr. Eisenstein had said. We're not just sending kids home and saying, good luck, parents. What we're trying to do is to create meaningful connections with these kids so that during the time that they would normally be in school, there will be opportunities for them not just to continue working with things that we have sent home to them, but stay connected with us in the school. We need to work with families. So part of that is that kids are not just going to be sitting there with their parents kind of twiddling their thumbs and wondering what to do, as they do many times on a snow day. We really want to make sure that there is this meaningful opportunity for them to reconnect with us, and during the period of time that they would normally be in school, are in fact given the opportunity to continue their work on school-related activities. So again, we've tried to think that through, and getting to the issue that was, I guess, the underlying issue is, what happens when all of these kids, are they going to the mall? No, I would hope that they're not. But part of that is what we are able to do as a school system in providing meaningful activities for these kids to be involved in on a regular basis. So, thank you.
You know, one thing I'll add, and then I'll take your question, Sophia, is, as parents, we know that children are emotional sponges. They're looking for us to see how to feel about certain things. So if we're panicked and we're stressing out and we're, driving ourselves crazy, they absorb that and they'll feel that way too. So I think another way we can protect our kids, take that deep breath, stay calm, tell them the facts in an age-appropriate way, and then just tell them the truth. everything is going to be okay. We're going to be fine. And I think that will go a very long way as well. Sophia.
That was kind of my question. So one of my kindergarten son's classmates is in isolation. And I said, what about the psychological? Like, what do you tell your kids if you're forced to be in the house for 2 weeks with them and, you know, taking their temperature and all this other, what do you say to them so they don't think they're dying? Because, you know, some adults are panicking right now, let alone little kids.
You have advice, doctor?
Yeah, I have teenagers who are quite astute too, and you know, you do notice, they read the papers. I think the rumors are, that was such an important point, and especially now at the health department, we're spending so much time trying to get proper information out. And sometimes you hear something, you want to know, how come we haven't heard anything from the health department? We have to make sure that the information we're providing is accurate. I think when parents look, I just told you the fact that no children have died from this, and that's something I said to my younger daughter, and you could just see a sense of relief when you take the information. Of course, she then said, what about parents? And I said, well, your parents are healthy and are not in the age that's typically suffering most from this. But I said, but this is why it's important to wash your hands. This is why it's important that if one of your friends is sick, just stay away from them. You know, you don't want them to bring that. You're going to be fine. We don't want you to bring that home to us or one of our neighbors who's a senior citizen that visits a lot. I said, it's everybody's part to play. So I like to make them proactive in getting the message that they are helping this. We're not going to sit around and be victims, even for our children. Now, that's much more difficult for a kindergartner. But I think the message that the county executive said is really important. It will be okay. And I think the message that you heard from the superintendents that when a school gets closed, should it happen for an extended period of time, that it's a structured time, that there's guidance. There has to be guidance and structure as best as possible to contain a sense of normalcy. And all of their friends are going to be out of school too. All of their friends and classmates are going to be dealing with it. And if the messaging is done right, I try and instill in people that we educate, let's make it a positive thing. Let's make the kids part of learning that they have to wash their hands. This is why I drive my kids crazy. Wash your hands. Don't touch your face. Now is the time that all those years of us saying that comes into play where you can save people's lives. And I think when you turn it into a positive message with the understanding that this is because there is an illness, but everybody can be part of preventing the illness. And I really believe that that makes a difference in the way kids will respond to it. I'm not a therapist, and I'm not an educator, but I'm a parent, and I do notice changes among them. They read the news. The worst thing, though, are the rumors. The rumors of, oh my, we've been very upfront with our information. We announced that there were 2 school bus drivers that are tested positive. And I can't tell you how many calls the health department got. Which kid is it in those schools that's the reason the school closed? We told you it was because of a bus driver, no kids. And you know, that's the kind of rumor that really changes the way people handle it. So please, let us give you the proper information. We've been doing so many events to give proper information, and we'll keep doing that.
We got a concern from a parent. I guess there's a large dance competition this weekend in Nassau County. The parent is concerned that this should not be going on. It should be canceled. Does the county ever get involved or plans to get involved in these sort of large gatherings that are planned?
I don't know anything about this particular dance competition. I do know my own personal calendar, things are flying off. Kiwanis, all kinds of events are just not happening. I think a lot of people are, especially when it comes to kids and other social events, especially, well, actually even more for seniors, things are being canceled.
They're saying absolutely this competition is happening this weekend. No ifs, ands, or buts. Is that something that the county gets involved in, or is that the organizer's decision and that's what they're going to do?
So let me answer your question and then give what the guidance is. To answer your question, if there's a circumstance that we consider an imminent public health threat, by all means the county will get involved. But there's also guidance from the CDC and the state. And right now the guidance is for people who may be senior citizens or may have an underlying health risk to avoid large gatherings. In that case, if we have a school building or community that's considered a cluster, in other words, what's happening in Westchester, an event like that isn't going to happen within that zone in New Rochelle. But it is up to private business, and dance competitions are private businesses, to make a determination, and there may be measures that they could take. For example, I have daughters who dance. Maybe to avoid large gatherings, they just limit it to soloists. So there aren't large gatherings, and you don't have large numbers of people. There are things that can be done to mitigate it. If there's a real outright large cluster, absolutely, and there's an immediate danger, the health department will get involved. But even now, you know, you've heard of this question's come up with sporting events, and the businesses make their own decision with our guidance. But it's really up to each individual to determine what is their risk, what measures are they able to take to be safe if they go to one of these events, and I think that that's the guidance from the CDC is the most important thing for people to check. They could go to the CDC's website as often as they want. It's updated very frequently, and it provides that kind of guidance for every aspect of society, for healthcare providers, for colleges and universities, for citizens, for clergy, for police, EMS, responders. So I think I said a lot. I don't know if I answered it, but thank you. Yeah.
One of the superintendents asked a question. You talked about e-learning, tele-learning. Will that be a decision made on a district-by-district basis, or will state ed tell you we need to do this? Because I know the individual colleges are making that decision. How will it work with the 56 school districts?
Each school district has to make a decision on its own, and it will depend on their capacity to provide that type of e-learning. And I will tell you that there's a wide variation in capability of doing that. But I can tell you that every school district in Nassau County, as we are speaking now, are contemplating some form of maintaining connection with the children that ultimately may end up being. I'm not sure exactly what it will look differently in every community, but every community is, and every school district, to my knowledge, is in fact working on plans to engage their kids during a period, if this should happen, of extended separation.
To follow up on that, as these plans are developed, and as Bill said, there's a wide range, a continuum of capacity and ability on the districts and the students and families in the districts, we will be reporting up to the state education department what we can actually do and how that will be evaluated, not only here in Long Island, but through other parts of the state. So there's more to come on that. And we're planning, as I said, we're in a good spot here in Nassau County, and that'll be compared and contrasted with what the state has and what the state puts in its regulations.
There are specific criteria. What you just said is one of the criteria. So if you
1, 2, check 1, 2, testing.
Good afternoon. Everybody know Dr. Howard Zucker to my left, Health Commissioner, Melissa DeRosa, Secretary to the Governor, and Beth Garvey, Special Counsel to the Governor. We want to give you a few announcements and an update today. Remember, the overall game plan is we're operating on 3 tracks, right? First is testing. Second is reducing density to reduce the rate of infection. And third is communicating with the people of this state so they know the actual facts versus the hype, versus the hysteria, versus misinformation. On testing, when you look at the experience in China, you look at the experience in South Korea, what changed the trajectory of the incline of the number of cases? It was a tremendous amount of testing and investigation. China, 200,000 tests per day. South Korea, 15,000 tests per day. They were so aggressive on testing that they actually identified the people who tested positive, isolated them, and then ran down the track of who those people may have contacted. Massive testing. This country, we've done 5,000 tests to date, according to the Secretary of Health and Human Services. So our testing capacity is nowhere near what it needs to be. Now, there'll be a retrospective one day. What happened? Why? You saw China November, December last year. You saw the case coming. Why did it take so long for this country to get a testing protocol done? That will be for another day. I'm a governor. I'm concerned about today. I'm concerned about tomorrow. So New York State is going to take matters into its own hand. We're going to start contracting with private labs in the state to increase our testing capacity. Remember again the chronology. We started several weeks ago. CDC said they would do all the tests and they would send them to Atlanta. We said that was too little, too late. They allowed the state laboratory to do testing. That capacity was several hundred. We said that's too little, too late. We have great labs in this state. Why the federal government wouldn't avail itself of the labs, why they wouldn't have had protocols and tests ready. So we are going to contract directly with the private labs in this state. There are about 200 labs in this state. The Department of Health routinely works with about 28 labs, which are expert in this kind of testing and virology, and where the Department of Health has a pre-existing relationship with these labs, where they're confident of the lab's work product, et cetera. We had a call with the 28 labs today. We informed them that they should get up, get running, and start moving forward with testing. There's still some complexity that the FDA needs to sign off on the actual protocols of some of these tests. That is still complicating the situation, but this will greatly increase our testing capacity as we get these 28 labs up and running. We had them on the telephone today. We had the communication today, and we're starting the mobilization of those 28 labs, but that'll make a big difference. But frankly, we're not in a position where we can rely on the CDC or the FDA to manage this testing protocol. So we'll be moving forward with that. Second track, reduce density. Why? Because if somebody is infected, you don't want them to infect more people. That's what we're doing in New Rochelle. You have that intense cluster. You know you have an intense cluster. Stop large gatherings where you have a large cluster of people who are infected. It's called common sense. And that's what we announced with New Rochelle. We're also announcing that CUNY and SUNY, starting March 19th, will move to a distance learning model. And both systems will be doing that. CUNY will help reduce the density in New York City. SUNY will help reduce the density in downstate New York. That's SUNY Purchase, it's Stony Brook, it's Westbury, et cetera. Downstate is where we have the highest density of cases now. So SUNY and CUNY closing March 19th, thereabouts. There are some different campuses, there may be some variability, but that will be a way to reduce density, and that is a good thing. I've also spoken today with hundreds of business leaders, primarily in New York City. I've asked them voluntarily to help reduce the density. There are a number of ways they can do this, different work shifts. Some people work early, some people work late, different teams. One team works 1 week, the other team works the other week. But again, ways to reduce density in the city. Telecommuting, working from home. All the experts say social distancing. You should be more than 6 feet from someone. Try walking down a New York City sidewalk and be 6 feet from people. It would be virtually impossible. So reducing density, how do you do that? Ask the businesses to cooperate. We're also going to be making a decision on the St. Patrick's Day Parade. We'll make that decision later on. I want to speak with a few more people, but I've been speaking with health experts, Dr. Fauci, who I believe is one of the best in the nation, who I've spoken to a number of times. He testified today, and this is his strong recommendation. Just reduce large gatherings. Why would you risk bringing thousands of people together, knowing that this is a virus that easily communicates? Dr. Fauci was talking about sports events, et cetera, but St. Patrick's Day is one of the great convenings, right, of a large number of people. So we'll be making that decision today. But if you listen to the experts, they would say you should not be having a St. Patrick's Day convening at this time, which I believe makes sense. We said if we're asking people to be quarantined, we are asking the legislature to pass a bill that says people will be paid by their employer if they're on quarantine. Lead by example. New York State will pay any person who is quarantined who is an employee of New York State. So if you're on mandatory quarantine or on what we call precautionary quarantine, you'll be paid if you're a state employee. Public transit, we've asked them statewide to double the cleaning protocol. There's conflicting information on how long the virus lives on a hard surface, plastic or stainless steel. It was at first a couple of hours, then some people said up to 12 hours, some people now say up to 24 hours, some people say maybe a little longer than 24 hours. We want to double the cleaning protocol just to make sure New Yorkers are confident. There was a situation in White Plains where an attorney who practiced at Westchester County Courthouse in the White Plains Courthouse tested positive. 6 courtrooms are closed for cleaning, and employees who had contact with that attorney will be on precautionary quarantine, and anyone who needs a test we will do. The overall number of cases in Westchester, you see again 13 new cases. That is probably the single most troubling point in the state right now. 48, 12 new ones in New York City, 28 Nassau, 212 statewide. This number, as I have said from day one, will continue to grow every day. The more tests we get, the more positives we will get. That's exactly what we are seeking. These are not random survey tests. This is not a random sample. We don't have people who are random sampling the universe to find out what the infection rate is. This is when we find the person who is positive, asking them who they came in contact with, and then testing that chain. That's primarily where these tests come from. And we're looking for the positive. So that is actually good news because it says we're successfully tracking the chain. These numbers will continue to go up dramatically. The more tests we do, the more these numbers will increase. These numbers do not reflect anyone's belief of what % of the population is infected. My theory, talking to everyone else, having no medical experience whatsoever, is the coronavirus was in this country before people acknowledged, and that it is much more widespread than people acknowledge. My guess is when we go back and we look at this, we will find that there were many people who had coronavirus where it resolved and nobody even knew about it. We're looking at a test that would test for antibodies that the body produces to fight the coronavirus to prove out this point. If a person has antibodies that were produced to fight the coronavirus, it'll show that they actually had the coronavirus at an earlier time, resolved, and moved on. But that's a test that the Department of Health is working on. You see it goes New York and Washington State. Number 1 and number 2 depends on the number of cases that day. Again, to the extent these tests are representative of anything. Death rate in Washington State much higher because it was of a vulnerable population. It was a nursing home. And that is the vulnerable population in a congregate setting. That is the most dangerous situation posed by this virus. Senior citizens, people with a compromised immune system, people with an underlying illness in a congregate facility. Third point is communication. Communication is making sure people have the facts, the right information, because the facts here do not justify the amount of fear. I understand it's a virus. I understand it sounds like a bad science fiction movie. This is not the Ebola virus. We've dealt with that. That was a much more dangerous, frightening virus. The facts here actually reduce the anxiety. We have 212 cases in the state of New York. 32 are hospitalized. Well, how about everyone else? They're home. They're recovering at home. Or they have recovered. But only 32 out of the 212 require hospitalization. And to me, what is the most definitive factual information is the Johns Hopkins study. Let's go back and track every case of coronavirus since we first heard about it. Let's go back to China to the first case and track all the cases and find out what happens. 121,000 cases. From the beginning, 4,000 deaths. 66,000 people recovered, 50,000 pending cases. 4,000 deaths are terrible. Yes, no doubt. How many people died in the United States from the flu last year? Roughly 80,000 from the flu. So again, perspective. Questions, comments?
On SUNY, does this mean that students who are living in dormitories will be sent home, or will they just be learning online for the remainder of the semester in their homes?
Beth?
We are developing plans as we speak in consultation with SUNY and CUNY to make sure that they can deliver all of these classes online. There may be certain applications where in-person instruction is still required, like lab settings. So the campuses are not themselves going to be closed, but the goal is to reduce the congregation of multiple students. So staggered class times, maybe breaking up class into smaller units, things of that nature.
For the rest of the semester, just to be
Yes.
clear? Okay.
Yes.
How many tests is the state running currently? Daily?
Can't give you exact number, but hundreds and hundreds of tests.
Like between, can we get a range there?
Way over 500 tests.
Way over 500. Are you up to the 1,000 per day goal?
Let
that
me
you
look
set?
for the exact number for you.
Okay.
What did the federal government say when you said you were going to go, New York was going to go its own route and start contracting with these private labs? Did they give
This has
permission?
been an ongoing conversation from day one, you know, right? From when they announced, well, all the tests have to be done at CDC. And then there was a tremendous delay, and CDC was a terrible bottleneck. CDC, their main lab was in Atlanta, so all the tests was supposed to go to CDC. They were going to send them down to Atlanta, then they were going to come back. We had a tremendous pent-up demand for tests, and that was just too restrictive. We voiced our consternation about that. Good word, consternation. I've voiced my consternation to you on occasion, so you understand what I mean by consternation. They then went to phase 2. Okay, the state labs can test. Yeah, but that got us a few hundred. That wasn't enough. And then this is the third phase where we can't just wait anymore. It's compounding the problem. And frankly, they can't put us in this situation because we're not able to do our job and our constitutional duty, which is to protect the public health. So we said we want to authorize the private labs in our state, and that we were going forward with doing that, and they assented.
I'm sorry to be kind of repetitive here, but can we be very clear on
Then don't be. If you're sorry, if you don't want to be repetitive, then don't be.
I rescind my apology. I'm not sorry.
Oh, so you're not sorry. So you're affirmatively repetitive.
I'm affirmatively
Aggressively repetitive. Go ahead.
Sure. So this is not a ban on in-person classes for SUNY. This is taking steps to restrict the number of people in classes. Can we?
Well, ban is nobody said ban. Ban is like a harsh word. We want to reduce density. The SUNY CUNY campuses will, now they're individual campuses, they have different programs, but they will be releasing students to the best of their ability starting March 19th. If students have hardships where they have nowhere to go and they're dorm students, then I'm sure an individual campus would take that into consideration. There'll be some situations where they have programs that must happen on site. They're doing a lab or something like that. But those are the exceptions, and those will be exceptions to avoid hardships. Otherwise, they'll be releasing for the rest of the semester to do distance learning, et cetera.
So, follow-ups on that. One would be, there's some students who are on break now that might come back on March 15th, for example, which would just be a few days before that. What happens in those situations? And also, what happens with the athletic teams, the athletic events that are supposed to be held on campus for the rest of the semester?
Yeah, the different schools have different breaks at different times. Your scenario, I don't believe the school would say, come back for 2 days and then we're going to release you. So different schools can calibrate it differently. Sports teams, I don't know. We'll get you the answer, though.
So if there are students,
Were you on a sports team at SUNY? I'm just curious.
Governor, so if you're on a SUNY campus now as a student, like living in a dorm, you're going to be sent home on March 19th?
The campuses on March 19th would be closing for the rest of the semester. If there's a hardship where you're in a dorm and you have no place to go, I'm sure that would be taken into consideration. And
That's
not going to close.
The dorms may stay open to accommodate particular student situations. What we are trying to do in coordination with SUNY and CUNY is to reduce the congregation of large numbers of people in classroom settings, so students will be able to return home if that's what they want to do and continue their studies at a distance, either through online or other mechanisms. But we don't expect that what we're going to do on March 19th is say everyone must find a new place to be.
They're not evicting, excuse me a second, they're not evicting anyone, right? They're not closing the dorm and kicking you out. They are going to distance learning. You can go home, do it by distance, go wherever you want to go, do it by distance. If you have nowhere to go, and that is a situation, then SUNY will work it out that you can stay in the dorm.
When it comes to paid sick leave specifically to the individuals who are private sector, you mentioned the public and taking that step forward, what do you imagine those provisions specifically for coronavirus to be in the legislation for paid sick leave? How many days would it be?
The coronavirus parameters. That's what they are.
So 14 days for quarantine?
It's a 14-day quarantine, yeah.
From the 28 labs that you had talked to today, do they need federal approval to do automated testing, or is this still manual testing?
Most of them do the manual testing. You don't have automated testing protocols available or authorized by the FDA. That's why I said it's a little complex. We can authorize the lab, but there's some of the protocols we can't authorize. But we want to move to the automated protocols. A couple of labs do have the approvals, right, Doctor?
Yes, semi-automated, sort of semi-automated.
You have manual, semi-automated, and then automated. Some labs have approval for semi-automated. Do any labs have approval for automated, Northwell? No.
So the 28 that you've spoken to are going to be doing manual?
Manual or semi-automated.
I don't think there's going to be more testing. Could you go over what are the guidelines for when people should be tested? Is there going to be more opportunity, or should it still be if your doctor thinks you should be tested?
No, the protocols are the same as they are. You cannot manage, you can't open a front door when you don't have the capacity to handle the tests, right? So we established a prioritization, if you will, of the testing. And that same prioritization protocol still applies. When and if we get additional capacity, then we can open up that protocol wider.
When it comes to Saratoga. SUNY too, is it all the campuses? And would it include graduations?
Graduations, I don't know. All the campuses, yes. Graduations, did we discuss?
We spoke to SUNY leadership just before this, and they're talking that through as we speak. But the expectation is that, yes, a large number of them will be not happening in person.
Anybody else at the Port Authority tested positive?
No.
When it comes to Saratoga County and some of the other counties that have low numbers at this point, is there additional testing happening that's come back negative? I know we're not getting exact numbers for the number of tests, but we spoke to someone yesterday who said, hey, I had direct contact with this pharmacist, I have symptoms, I was told no test, and that DOH said there's only 1,500 tests in the state. So again, that's someone talking, but are other tests being run in these low areas right now, or are they just not priority?
Yeah, no, you get the same protocol applies across the state. It doesn't make a difference if you have a high density, low density. It's the same protocol all across the state. And yes, we run tests that come back negative. You don't hear about them, but they come back negative.
Governor, could you speak to why it's so difficult to find out exactly how long the virus can survive on hard surfaces?
You have different opinions from different tests, literally. So, you have a number of different scientific organizations that do tests. Some people say we did a test and the virus lived for 2.5 days on stainless steel. We did a test and the virus lived for 2.5 days on plastic. Some people say that's the aberration. Normally, the virus only lives for a couple of hours on stainless steel. So it's who do you want to believe at this point? Right, you want to answer that? Go ahead.
Sure, also temperature, humidity, there are many different environmental factors that come in to how long this virus or any virus, or for that matter, any bacteria will live on a surface.
Governor, on the New York City St. Patrick's Day Parade, what authority do you have to
I'm sorry, Bernadette Hogan.
Governor, what point of authority do you
I knew that one was going to strike home.
Yeah, so what point of authority do you have
Oi.
on March 17th to close
Yes.
down the New York City St. Patrick's
Well,
Day
I'm
Parade?
authorized, you know, by St. Patrick. That's who? Oh, yes, I have the highest authorization, sure. Yeah, yes, it's in the job description. You got to take a look. It could be, maybe. Or maybe I just ask the Archbishop, what do you think? Too late, too late. I'm going to be speaking to the parade organizers and the people who are involved and see what they say.
Do you have the ability to close down other counties? Like Onondaga County right now has said that they're going to continue their parade. What about other cities
Well,
as
look,
well?
you have to look at the situation in that locality because you do have very different situations across the state. If you have a very low density of low density of caseload, then, you know, you can argue, why should you close it down? You have just a few cases. New York City, you have a fairly high density of cases. You have a cluster of cases, and it's a huge parade. It is not, I love the St. Patrick's Day Parade, just so you understand, Bernadette Hogan.
Your family's half.
Half, that's right.
Yeah. What do they think about it?
I haven't told them yet.
On nursing homes, have you gotten any closer to the point where you think that they're going to be ending visitation? And any idea how long, Governor, Doctor, the changes might be at nursing homes as far as limiting visitation?
I think we have had some nursing homes where we've limited and closed visitation. We're going to continue to move forward. We're monitoring all the nursing homes, and as I mentioned the other day, also putting out posters and other forms of information for people who want to visit.
Similar question on authority, the containment area in New Rochelle. Are you using your authority through the law that was passed last week? Is there something else in public health law? What legal authority do you have?
We haven't, there hasn't been a mandatory, everything that we have done to date has been basically by agreement. I don't think we've had any situation where there hasn't been concurrence. So it hasn't become a question of legal authority.
So, but by that method, you know, a church could hold a service this weekend, and face no consequences?
Well, I don't know about consequences for a church, right? It's beyond my pay grade. But there hasn't been any situation where it went to the question of legality.
Governor, can you comment on how much you expect the capacity for testing to grow with these 28 labs? I mean, how many more tests are you going to be able to run? And then how does the new antibody test, how are those going to be rolled out, and how many people will be able to get those?
Yeah, I'll let the doctor speak about the antibody. The problem with the testing capacity is we're not in control of the entire situation. So we have 28 labs that we have existing relationships with. They do virology. They're labs that the state health department believes are highly qualified, but they then need protocols approved by the FDA and tests approved by the FDA. So it's not like the state can just say, okay, you're a lab, here's the protocol, here's the agents, here's the assay, go. Because you always get this overlap with the federal government. You know, it's primarily a federally regulated system through the FDA. So that's why it's hard to manage from the state side because we don't really manage it. The antibody test, you want to speak to that?
Sure. Thank you, Governor. So the antibody test would be a way to measure to see if somebody actually had been exposed to coronavirus and didn't even know it, was sick, and got better. And that's in development. We need to actually obtain individuals who have had symptoms or are positive for coronavirus and then look in their blood to see if they've developed the antibodies, and then it would be a matter of scaling that up. So we're in the first part of this, and we'll move forward on it. couldn't hear you,
Do you
sorry.
have a timeline for when that will be
Not
done?
yet, but we can get back to you.
There's
The
a
Department of Health has issued regulations to the nursing homes. Are we going to see similar sort of guidelines for adult daycare centers or senior congregate facilities?
I think that we are doing this not only with the nursing homes, but also with the adult care facilities as well. And we have to tailor it for each individual facility, depending on how many people are there, the structure of how it's designed.
So is there going to be some sort of guidelines similar to the nursing homes?
Well, we're working on guidelines for the nursing homes and also for those facilities, yes.
Are the 28 labs that you're contracting with, are they FDA approved at this point? Are they ready to go, or?
No, they are state approved. Some of them have protocols and tests that are FDA approved. Some of them have protocols and tests that are not approved by the FDA, and they're waiting for FDA approval.
So how much will that increase capacity?
We don't know yet. We don't
There's an
know. That's what we're just trying to, we just got off the telephone with them.
There's an election coming up, Governor, for Queensborough president on March 24th, and of course, April 28th is the primary here in New York State. Have you considered any action to either expand absentee voting or change
No,
the way people vote?
not at this time.
Would you slash the amount of signatures that petitioners need to get?
We've
to
had
the
no
ballot?
discussion about that at
What
this time.
about just generally gathering people in place? We're talking about you don't want 200 kids in a lecture hall, you don't want 200 people in a church or a synagogue on a Sunday, but we've got the NCAA tournament coming up. You don't want
Dr.
City St.
Fauci-
Patrick's, maybe you want, but San Francisco is banning everything. Washington's banning anything over 1,000. So
Yeah, that is exactly the question. St. Patrick's is obviously the extraordinary outlier, right, for concentration and density. But that was what Dr. Fauci was talking about today. He was talking about sports events, et cetera. And look, you don't want to shut down society, right? Because that's massively disruptive to the economy, to life, et cetera. But your main concern here is the public health crisis, and it's balancing the two.
Does that include also community campuses that are affiliated?
Yes. Pardon my Irish brogue, I know it was terrible. Must have been offensive to your ears, Bernadette. Not at this time. We are going to stagger the LCA.
Okay, we'll get started. So good afternoon, everyone. I'm Josh Jabal. I'm Chief Operating Officer for the state of Connecticut, and I'm heading up, on behalf of the governor, the cross-agency group that is working to respond to COVID-19. I'm joined by several of our commissioners and Dr. Matt Carter, state's chief epidemiologist. We have a number of updates to provide, and we're going to start with some updates from the public health side with Dr. Carter.
Good afternoon. My name is Dr. Matthew Curran. I'm the state epidemiologist with the Connecticut Department of Public Health. To start out with, I'd like to acknowledge for all the folks that are out there that what we're going through is incredibly difficult. We have not seen a pandemic like this in 100 years. And none of us who are in this room today have ever been through anything quite like this, with a new virus that none of us have ever been exposed to before, crossing the world and now in the United States and now in Connecticut. These are challenging times. But like other pandemics, there are things that we can do to slow it down, make sure our hospitals stay open so that they can take care of people who get very sick. We know that the vast majority of people who do get sick, at least 80% of them, will not be sick, can recover at home. They will not need to be hospitalized. Others will need to be hospitalized, and treatment will help them. We don't know what the mortality rate will be for this disease in the United States. We know that some of our our citizens and residents of Connecticut will not survive this, but our goal is to make that number as small as possible. Yesterday, the State Health Department laboratory confirmed a third case of COVID-19 involving a Connecticut resident, a resident of New Canaan. This person is elderly and lived at home. This person has no known exposure to COVID-19 that we have been able to identify yet. This would be a community-acquired case of COVID-19. Right now, the State Health Department is working with the local health department to identify contacts of that person and make sure that they are at home if they are well, and those folks will be monitored. If they develop illness, testing for COVID-19 will be arranged for those contacts. This period of case investigation and contact investigation is probably not going to last very long, maybe a week or two, because after that there'll be so many cases that it will not be practical to actually continue to conduct in-depth interviews with cases and identify their contacts. I think the message that I want to, for folks, and I've gotten a lot of phone calls in the last 24 hours, is that we need to assume that COVID-19 is here. That is especially true in the southwestern part of the state. You've probably all seen the media articles about what's happening in New Rochelle and Westchester County. There are people who drive back and forth between Connecticut and New York every day. But we also have an outbreak in Massachusetts and an outbreak in Rhode Island. And it is only a matter of time before we have widespread community transmission throughout the state of Connecticut. The people I've talked to have said, you know, I've got a fever and a cough. I feel like I've got the flu, but what should I do? I'm home. I'm saying if you have fever and a cough, for example, and you are in the southwestern part of the state, you should assume that you have COVID-19. You don't need a test to tell you that that's what you have. You should assume that that's the illness that you have. Most people will get better at home, especially the younger you are. That will be the case. You should talk to your physician. They can provide you advice for how to care for somebody with COVID-19 at home. There is guidance on the Centers for Disease Control website about staying at home, taking care of people at home with COVID-19. At this point, you know, our state public health laboratory is only doing testing for people who are hospitalized and who have fever and cough and shortness of breath. The reason for that is that's critical information for our hospitals to use so that they can stay open. They need to be able to identify patients with this so that they can take appropriate precautions in the hospital and protect our healthcare workers from getting infected. This is going to be critical because we're just at the beginning of this at this point in time. It is our understanding that the commercial laboratories, Quest put out an announcement on their webpage today saying that they're open to receive samples from the entire country. That's different than a couple days ago when they said they were only accepting specimens from the western part of the United States. Other labs are coming on board. We hope to have at least one or more of our hospital laboratories having testing capacity sometime next week. This will take some of the burden off the state public health laboratory. Testing will be increasingly available, but you do not need to wait for a test result. You should assume that if you have fever and cough, and think about those times when you've had influenza, fever, cough, headache, muscle aches, body aches, and you feel like you've been run over by a truck, well, throughout this winter, that was probably influenza. But moving forward, that's probably COVID-19. And we take care of people all the time who have influenza. There are special instructions for COVID-19 on the CDC website for taking care of people at home, and we ask for you to do that. Right now, that's the biggest thing for folks, and all of you in this room may well be dealing with decisions about family members relatively soon. Somebody who gets a fever and a cough, who stays home, who takes care of that person. These are things that we will all have to figure out how to do. Those of us who are older and over the age of 65, there's at least one or two of us in the room, we'll have to make decisions about, do we avoid crowds? That's the current recommendation. Or a family member gets sick. Do we go take care of them? Or do we wait for them to get better if they're 22? These are all things that, as individuals, we will have to make decisions about as we move forward. And this is difficult. But our goal is to get, as a community, through this all together as best we can. That's my update at this point in time.
Dr. Carter, I don't think I've ever seen you quite so sober, but I've got some very important questions for you. We've heard from a number of package store owners and beer distributors that are concerned about receiving unwashed bottles, empty bottles and cans for deposit. Should that be suspended in your view?
This virus doesn't last very long on surfaces. That's the good news. I mean, many of you may have heard the word norovirus. That's the one that causes vomit, nausea, vomiting, diarrhea. Well, that virus is really hard to kill, and it stays around on surfaces for days. This one does not. It's actually easy to kill, lasts on surfaces maybe an hour, maybe a day. So bottles, cans, if they've been in that system for a little while, they don't have viable virus there. That's not going to be the issue. This is going to be really person-to-person transmission in the sense that being close to somebody who's coughing or sneezing, who's actively sick, or somebody who's coughing and sneezing and may have touched their nose or and then touched the door handle, and then you touch that door handle right afterwards. That's going to be the issue.
More to present. Okay, thanks for that.
Thank you.
Okay, a couple other updates. In light of Dr. Carter and our public health team's assessment of the situation, the governor's been busy today on the phones. He's been speaking extensively with leaders of some of our large employers. He's been speaking with a number of leaders of our large religious organizations. He's spoken with Scott Gottlieb, former commissioner of the FDA, also a Connecticut resident, who some of you may have heard on the radio this morning. I did on my drive-in, sharing broad messages, very much in line with what we've been doing in Connecticut, to be very proactive about looking at large events and the types of interactions that, as Dr. Carter described, are at high risk for transmission of COVID-19 and looking to discontinue those. And so the governor's been sharing our position as a state and the things that we're recommending people do. My sense is that there's not anyone who leads a large organization in this state or probably in this country at this point who's not looking very actively at large events in particular and looking at ways that we can either discontinue them, turn them into teleconferences, postpone them, or take other actions to reduce the risk. Another update is that today we, in anticipation of what's to come, we took the step to, in recognition of the known fact that there's a global shortage of personal protective equipment for people who will be dealing with the acutely ill patients, we've made a request of the the strategic national supply for a total of 540,000 additional N95 protective masks. So we don't need this today, but we're planning ahead in anticipation of needing additional supply in the weeks to come, and we expect to receive the first delivery of that next week. Finally, we were also notified today that state of Connecticut is going to be receiving $7.1 million as funding through the public health emergency funds in the most recent federal appropriated bill to help fight COVID-19. The mechanism for how that will be distributed is still to be communicated by the feds, but we have been given indication that funding is on the way. And I think with that, we will take your questions.
The case, doctor, was where again? New Canaan?
Case of elder resident of New Canaan.
And did you say it was elderly?
Elderly, yes.
What does that mean to you?
Older than you and me.
Can you give us over 65? Over 65?
Yes.
It's a man or a woman? Did you say?
I didn't say.
You didn't.
It is a man.
It is a man?
Yes.
Did you say where he contracted the disease?
Unknown. That's why we're assuming this is a case of a community transmission.
So if he has not had contact with anybody with the disease, so how might somebody who has not had contact with anybody get
Well, that's where the case investigation comes in. It's trying to interview the case if possible, identify anybody he may have had contact with in the week before he became ill. That's in progress. But right now, this isn't like the other two cases where we knew the person became ill right after returning from California or right after returning from Nevada.
You stress the need to be vigilant now because the virus is here, but eventually, like the flu, it will slow down. Can you elaborate on that? I mean, what do you suspect will happen?
It's a great question, and thank you. I don't have a crystal ball. I mean, we're assuming that this is going to act like other respiratory viruses, like the flu. And when flu comes, it's usually here for 6 to 8 weeks. If it acts like this, if this coronavirus acts like influenza, this will be what's called, pandemics are not like seasonal diseases. They happen at times of the year that aren't what we normally see, like March and April and May. If this is anything like the pandemic of 1918, I'm not saying this is going to be as severe as 1918. It seems pretty clear that that's not going to be the case. But what many people in public health who do this work related to epidemics think that this could be a spring wave. Well, we'll see transmission, for 6 to 8 weeks in this period. If you remember, 2009 was the H1N1 pandemic. It was no more severe than seasonal influenza, but the first cases were diagnosed the last week of April, and we had cases in Connecticut in May and in June. And I remember standing in an elementary school where the absentee rate was 40%. But because it was no more severe than seasonal flu, no schools were closed at that time.
Right, because we had a public health emergency in 2014 with Ebola under Governor Malloy.
That was a very different circumstance because Ebola is transmitted in a very different way. It's really bloodborne. I'm trying to draw the analogy that, because you asked me what do I think may happen. I think we'll see a first wave between, over the next 6 to 8 weeks. I don't know that for certain because this is a brand new virus that we don't have experience with, but we know other coronaviruses that cause the common cold, for example, are seasonal. In pandemics, it may well be that we have a second wave in the fall, just like in 2009. If you recall, we had cases in April, May, and June, and then we had a second wave in October and November and early December, which is really early for flu. But that was the second wave of the pandemic in 2009. And so this may well occur where we're dealing with a wave now and a wave later. Right now our focus is on trying to mitigate the first wave and to slow it down so that we don't want everybody getting sick all at once. Because if everybody gets sick all at once, the hospitals are overwhelmed and you can't take care of people who need to be hospitalized. So the goal here is to slow down the transmission so that our hospitals can stay open.
We have a little less than 10 minutes left. We got Could you just address why some people are unable to get tests? We've heard from a woman, for example, who has been to New Rochelle recently, lives here in Connecticut, and is concerned. She's exhibiting no symptoms, but she can't get a test.
That's correct.
Because she's not in the protocol. Because if she has symptoms, she would get a test.
We can test 40 to 60 people a day at the State Public Health Laboratory. That testing is for every acute hospital in Connecticut. For For people get sick with pneumonia and acute respiratory distress all the time. And our hospitals need to know which one of those is COVID-19 so they can take appropriate precautions. This is taking all the resources of our lab right now. The focus of our laboratory testing is keep the hospitals open, protect the healthcare workers in the hospital. In New York State, the New York State Laboratory has a large capacity for testing. And they are recommending that Connecticut residents be tested who do not have symptoms, and then telling the Connecticut residents to go back to Connecticut to go get a test. I've actually reached out to the New York State Health Department about that issue, because they're in a different place than we are in terms of test availability. Right now, we are not testing people who are not sick, and we are not testing people who are not sick enough to be admitted to the hospital.
Dr. Cardona, would you be kind enough to address the issue with the schools? We've seen several more school districts close in the past 24 hours. Would you be kind enough to tell us the impact? What are you hearing from the schools, and do you expect more to follow?
First of all, I commend the superintendents who have taken the action to limit events of students, more than 100 students or 100 guests in the schools. Currently, Region 14 is a district that closed. There's a school in Stratford, and today Westport schools closed, not because they have someone with coronavirus, but because they have a student that might have had potential exposure to someone with it. So that's the update with the schools. I think what we're asking districts to do is to continue to limit activity where there are over 100 people in attendance, and we're all going to experience inconveniences with this, but the decisions we make in the next week or two are going to protect lives. So we encourage districts to continue to limit large gatherings. Thank you.
Dr. Cardona, has there been any requests for waivers for 180 days here?
We have gotten one request, and there are several in the queue.
Can you tell us where that is?
We have a request from Glastonbury schools. We have several requests that are probably be coming in, and we're manning the email link to superintendents with 2 staff members from the State Department of Education. So every request or every question from superintendents receives an answer within an hour.
And are those routinely approved?
Well, we'd be reviewing those, and it would actually be a function of the State Board of Education, so we're engaging them in the process. Thank you.
Doctor, could you tell us how many of the 10,000 folks who arrived at JFK from China are Connecticut residents? Was that broken down?
I don't have that figure, but this is what I would like to share with you about that. We monitored, starting in mid-January, more than 150 travelers from mainland China in Connecticut. Of those, maybe 4 or 5 developed symptoms of fever and a cough. They all tested positive for influenza or one of the other respiratory viruses. None of them had COVID-19. The first 2 cases of confirmed COVID-19 in Connecticut involved, the first case was related to travel from California, and the second case was related to travel from Nevada. So the focus no longer is on international travel. The virus is in this country.
How many cases has the state lab tested, and how many are pending testing?
Well, I have a piece of paper with that number on it. Hold on a second. We tested 74 individuals so far. 71 are negative. So 3 positive, 71 that are negative. We have another 16 pending for today.
How many after that are still waiting? Is the 16, will that clear any wait for?
No, there are any specimens that are received after 10 o'clock in the morning go into the runs, may go into the runs for the next day. Our lab is running 7 days a week, at least 2 shifts. They're training. Right now there are 5 individuals who are certified to do this test at the state laboratory. Next week, that total should be 7, and they expect to be running 3 shifts. As I said, our goal is to make sure our acute care hospitals have the testing that they need.
Would you suggest that Connecticut residents not leave the state, or just not go to any large?
Well, certainly it's already been recommended that older people who are older than 65, like myself, should consider not attending large crowded events. That's a national recommendation that's already been made. My daughters have already told me that if they catch sight of me anywhere near a crowd, they will drag me back. And I think all of us probably might find ourselves in similar situations. So that's what's currently recommended. We are not going to take the path of China. The experiment, what's going on in Italy right now is unique. You may have heard they've closed the entire country by regions and prevented travel between regions. It is an experiment in social distancing. All of us will be interested in seeing what happens. They're trying to do that to knock down transmission through the whole country. That's not the plan in the United States. The plan in the United States is to close those things that we can close and stay open for those things that need to stay open. I mean, people still need to go buy groceries. That's why we're asking them to self-monitor. You may have seen pictures of China where they have people delivering boxes of food to people who can't leave their apartments. We're taking a different approach here. We're trying to keep some things open so that day-to-day life can continue as best it can in the middle of a pandemic.
Were you talking about one more question? Just one more question about older people?
Yes.
You're talking about older people with existing health problems, not older healthy people.
Even older healthy people, 65 and older is an increased risk. And if you have other diseases in addition to being over the age of 65, your risk goes up. And that includes me. It might include others as well. And so this is something we all need to be aware of.
All right, great. Thank you very much. Thank you, guys. Thank you.
Good job, Doc. Thank you.
Yeah.
Sorry, guys, we have a conference call we have to jump on.
That's all right. I haven't been able to call.
Every day at 3:30, we're gonna have this call, so we're gonna have it every day at 3:30.
Do you have a couple?
Well, I think I got to follow this guy.
What is social distancing? How far should I stay from you?
4 to 6 feet.
Thank you very much.
Are you recommending that people not travel? Just routine travel, and even within the state, like this? There's no crowd around. No, but we're not asking people to stay.
consideration. No,
Yeah.
nothing to hang on
No,
to.
I
We can
think-
just put it on the
I
seat.
think simple stuff like that, yes, we will address. In fact, one of the doctors.
No, I was actually joking. I was being very facetious.
One of the big questions yesterday, which was great, was they told me that cleaning is very effective for the virus. You know, and wipes,
Yep.
whatever.
Yep.
And that one of the good things that we all came to the conclusion that may result out of this weeks and months down the road is if we've managed to get everyone in the habit of washing their hands,
You
that's
can?
great. That would be super.
Yep.
So, look at you, you're ahead of me. Thank you, pal. Another one.
Thank you.
Yeah, it's nothing fancy. Basic hand washing, you know?
Yes,
Standard household cleaning.
Exactly. And please don't be afraid to play off of each other. So if she says something that triggers a thought in either of your minds, please jump in.
Sure.
For the broadcast session, what we'll do is we'll get to the end of the Facebook session. I'll say thank you very much. We're going to take a quick break, and then we'll kind of briefly prepare for the broadcast. For the broadcast, I think we'll have a minute 15 to get through the three of you. So that's pretty quick. And I would ask that you don't go so long that you sabotage her time, if you know what I mean.
They're friends. They go way back.
Then you guys can,
No, I'm just gonna slap her down.
you can just whine over this
See, that's
later.
what happens.
See, that's good TV.
Double A.
That's good TV, so go ahead.
So Joe, right
Yes, ma'am.
now,
Can we spread
I
out
know that
words?
there's
Is this
gonna
one
be,
of
in the 4 o'clock show, I don't know which block yet,
Did you
there'll
want
be
me
a
to
bump
move up more?
shot of us.
Okay.
And then
'Cause that's
there'll
like a
be
whole to-do.
segment.
Oh, that's up
Is that
to you,
too
whatever
short?
you
I have
wanna
to
do.
hop
I'm
down.
waiting
Like
for
to do
information
it.
on specifically where it's gonna fall in the 4 o'clock show, all these things.
I just asked Alexander real quick before I came down. Roughly 424.
424 for the segment or
For
the
the
bump?
segment.
Segment? around
Yes.
424. Okay, that's very helpful.
And I wouldn't be surprised if it's more than one bump.
Okay,
But,
Alright.
you know, we'll be talking by then.
perfect, great.
So,
Great. I don't know if you wanna put your IFB under your jacket.
yeah, I do, and Candy gives me grief about that all the time,
It looks
so,
nice.
anyway.
So, yeah, less than 7
Alright,
weeks.
so that is being fixed, it'll just probably take 15 minutes to get
Okay.
a new placard.
In the
So,
meantime,
we'll just, we're
We
fine.
don't know how long it's
if it's 3 placards or it's no placards.
We're gonna get
so-
rid of these,
Great.
yeah, so, yeah.
It's
It's not very long.
Right,
But
we don't know.
there's not been determined, it's
Exactly.
certainly not days and, you know, it's
Oh.
not like hepatitis B, which could be there for so long.
Sorry.
No
problem.
Just tell me to sit down, man, next time.
I think once stuff dries, probably no more, because it's a droplet, so this is not the kind of thing that's gonna live and dry. And it's not. Viruses don't. It's 100% not airborne, it is droplet.
Yes, that'll be one question.
Although we are
I won't
treating-
use the word 100%. Nothing
At this
categorical.
point- at this
I was
point,
answering you,
Yes.
nothing categorical as an answer.
And because it's 3, we're gonna do Facebook Live at 4 o'clock, Facebook Live at 5 o'clock. They're different audiences, so we may cover the same question more than once.
We'll get better at the right answer.
Exactly. Usually the second or third time it's better than the first. I've lived that my whole life like that, so.
I am feeling very uneven. Why am I feeling uneven?
Tell 'em.
Am I uneven?
Meryl, do you have a mirror?
Where do you live?
I live in Manhattan, on the Upper East Side. That's me, yes.
Okay. Martha is closest to Joe.
Tanya.
Tanya? Tanya is in the middle.
Sarana.
Sarana is on farthest away. So.
Where's home for you?
Upper East Side.
Beautiful. Real close. Good, good, good. Did you guys watch the governor today?
Tanya.
Not today. What was said?
What did he say?
I listened in the
SUNY
morning.
and CUNY, the big things are SUNY and CUNY classes. We'll go to online.
Yeah.
Effective.
So following other major.
Yes, following other institutions. There were one or two other things. Number of cases, private labs getting up and running again.
Quest, from what I understand, closed.
Marta, if you can count to 5.
Only California,
1,
because
2,
they
3,
said that
4,
they would
5.
that they would offer testing. So City MD apparently has a
That's the hardest part of
relationship
what we're
with
going to do
Quest.
today. So you
city
pass.
MD.
You can stay.
okay,
Thanks so
okay.
much, Marta.
Tests a day, so
Good.
Quest stopped. I said only California for now.
Wow.
I'm a New Yorker too, so.
But that I didn't read
Good.
about. That was hearsay, so I'm not
Sure.
quoting it.
1, 2, 3 is fine.
1,
It won't be
2,
out loud,
3.
but anyway.
How's that?
I'll get her to talk.
Oh,
Where'd you do your undergraduate?
Harvard.
Marta, yeah,
Harvard,
keep-
and your
keep talking.
Medical school was Duke.
was Duke also? Okay, so you bounced around a little
And
bit.
count to 5.
Okay.
1, 2, 3, 4, 5.
And your specialty is
Infectious diseases.
infectious diseases.
And keep
Got it.
counting.
6.
Oh, good. Thank you.
Okay.
And then, are you ready for Tanya?
Tanya did her schooling where? At undergraduate.
Haverford College outside Philly. And then
Yes.
I went to Jefferson for med school.
Stayed in Philly. Okay.
Yeah, and then Sinai for residency. And I'm an allergist immunologist, faculty at NYU.
Okay.
Thank you, very
Beautiful.
good. Sarana, if you
Yes?
can, you can tell us about yourself also.
Okay, isn't that great? So I went to Barnard. And
I do,
then Mount Sinai Medical School.
Just talking.
Great, thank you.
Can you talk a little more, Chuck,
Okay.
just so I can hear you? And that's, yeah, I do hear you. I had it up way too loud.
Why do you think young children aren't getting the virus?
Probably because it's not triggering a
Do you know what
cytokine
time?
storm.
We're,
It's not that they don't.
We're ready
get it.
whenever
I
we're
think
ready.
their
So,
disease is much more mild.
okay, so give
Unlike
Chuck.
you know, some
Are you ready, Chuck?
The H1N1 when we saw high school kids dying.
Go.
So if anything,
We're in no rush.
this virus
Okay,
is
so
It's hitting the
triggering-
predictables.
give me another 4
which is
minutes.
The old,
We'll try.
old.
Yeah, we'll try and go. You know, we'll try and go straight up at 4.
So perhaps this is because
Yeah, but in this
Okay.
case,
we're
they
protected with
haven't-
the underdevelopment of the immune system, or at least that's the
Closest to me.
point there at the moment.
I'm going to have them introduce themselves, Chuck. So I'm going to say hello, welcome, blah 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 blah.
Yeah.
Experts here with us. Why don't we have them introduce themselves, and they will go down the line.
If you have pre-existing lung damage, it's going to be even more. This kind of conversation, this is perfect. I feel like this is what people are going to want
it's
to
a
hear.
lot of fun to
Super.
talk about this. But I'm afraid he's going to be
You got it, man.
interrupting
Yeah,
us.
it's totally
It's gonna
flying
be
by
an
the seat of
issue.
our pants. Yes.
It's for
Okay.
you to slap him down over there.
You got it.
Is he listening to us?
No, he's talking to
Who's that?
Okay, good.
No, I wasn't listening. Should I have been?
No,
we were talking about
I told
interesting
Marta to
things.
slap you down so you don't interrupt our conversation. But then
My-
you weren't listening, so you didn't need to know I said that.
You will find a distinct difference in my approach between the Facebook and the broadcast. The broadcast is timed, so I have to sort of keep you in line.
2 words
if you
or
will.
less.
So, and traditionally, I want to hear from each of you in the minute 15, minute 30 that they give us. So, and we've prearranged some questions, and I can even tell you what they are. So at 4 o'clock when we do the broadcast hit, how long do the symptoms last? If you do get it and it's not serious, ask Jason from Poughkeepsie. So I'll start with you, and if you want to piggyback off that, great. And if there's time, we'll throw in another question. Will the virus possibly end before June?
That'd be nice.
It would be nice. We had,
And R.I.P. Rest in peace.
yes, that would be great. I did, in looking at the questions ahead of time, there were quite a few that were inquiring about warm weather
Yeah.
and what the impact is.
We don't know.
So I think that's reading into that a little bit.
Yeah, it's probably, they're asking following sort of the influenza activity, how
Okay.
it's sort of the activity goes down
Okay.
and then comes back up, so that's probably
Okay.
why.
We did get a lot of good feedback in the sense that people liked the straightforward answeredness, the fact that it was not hype.
And if we don't know,
Yes, and if you don't know, you don't know. But I think they were also looking for clarity in the sense where you have the governor saying one thing and then Dr. Fauci or someone else saying something else. So,
Yeah, one of the things we were just talking about is, why is it not impacting children as much?
Yes.
And so what does that mean? Is there something, perfect, is there something about the child's immune system and how it differs from the adult immune system? So we just had some good banter about that
Yes.
actually
question.
much
No, let's clearly
longer
discuss that
division name,
because
but I said okay.
we did discuss it yesterday,
It goes on
and
for the line,
the doctor
but-
who was sitting where you are was a pediatrician, and she said none of the cases have been for children 10 and under
Right.
anywhere. So they seem to.
So the two of them are really talking about a mechanism of action around that. One has to do with the age of the lungs
Okay.
and that there could be pre-existing damage, and then the other is just that the underdevelopment of the child's immune system could confer a benefit.
Okay. They also talked about 60 plus, and I've got one or two questions.
Yeah.
Was Eric Cruz in here yesterday? I know that there was
No,
an Eric from Leatherneck
it was Eric.
Or Eric from North.
Eric Choi Pena.
Oh,
Eric Choi
okay.
Pena.
I assumed it was, okay.
And then Sharon. I can't remember Sharon's last name. She was a pediatrician. Yep, go ahead.
We can go ahead and start the Facebook part and figure out the lights for the broadcast, but I want to get the Facebook stuff on. It's okay, we'll chat with you. But then when are you gonna find time to fix lighting?
The last 2 weeks, that'd be like the max, right?
So
7
it
to 10
depends. Well, it depends. Some people
thought
can have
the,
very mild
governor-
symptoms, so could be a day, a
It was
week.
really good in the
The
sense of trying
severely
to
ill,
separate fact from fear.
once
fear.
it's hard to say
And
when
hopefully you
the
guys-
infection has finished
Yeah.
and then
really
the
was.
damage.
So-
And then it's gonna be a house of cards.
Hi.
Hi, this is Tara. She's the super producer.
Hi.
She's just the best.
Just a producer, not a super producer. Thanks for being here. Did Joe go over everything with you?
Yep,
Okay, how we'll
best
do a
we could.
Facebook hit, and then we'll come down and stop, and then we'll do the broadcast hit.
And the broadcast hit is
with more details.
Yes,
if you want. Yeah,
it's tight.
Facebook's more casual, conversational, and then the broadcast is more structured and whatnot. And that's only like a minute and a half.
Yeah.
We'll do Facebook for 20.
Tom says it looks fine.
Okay.
We can go with it,
Okay.
and
All
then
right.
make any modifications.
Okay, so Meryl, I guess.
So by the end of the show, I won't be able to go to Westchester. It's got the little containment area.
20 more positive cases, so we're at 193.
Say again?
Oh, that's not for you.
No, I know, but if that's right.
New York State, whatever.
I haven't looked at the map.
Very soon the
Oh.
world is going to put the United States on that list of
What is it, tier 3?
the level 2, level
And I would,
4.
stay away from numbers.
Yeah,
30. That's my camera? That's my camera?
This is your camera,
It's-
wide
it's-
shot, and
we're opening on me or on the wide?
which camera? Joe's camera? Opening on you, Joe.
Thank you.
In 10, 9, 8, 7, 6, 5, 4, 3.
Hello, everyone on Facebook. Thank you for tuning in. I'm Joe Torres from Channel 7 Eyewitness News, and thanks for joining us once again for yet another question and answer session regarding the coronavirus. We did this yesterday. It was so successful. We said, you know what, let's do it again. You all gave us a lot of good questions, and hopefully we provided some answers. We're going to try that again. But you also gave us some good feedback in saying that you liked what we were doing, that it was simple, that it was straightforward, that it was easy to understand. We've got three fabulous doctors here. I'll let them introduce themselves, and then we'll get to your questions. Why don't you start, Dr. Marta?
Hi, I'm Marta Feldmesser. I'm Chief of Infectious Diseases at Lenox Hill Hospital, Northwell Health.
Perfect. Dr. Tanya?
Hi, I'm Tanya Elliott. I'm an allergist and immunologist at NYU Langone Health.
All right. Dr. Serrana, how are you?
Hi, I'm great. I'm Serrana Siegel-Moore, Division Chief for Infectious Diseases in New York Presbyterian Queens.
All right. Thank you all for being here. We've got a boatload of questions to get to. Before we jump into specifics, let me just go down the line in terms of facts versus fear. and you've seen the fear. You're in the hospital, so you've probably seen it for real. Does the fear match the facts in terms of what we know regarding coronavirus?
No, I really don't think it does.
Okay.
I think that we
Can dial it down.
Okay.
Yes.
I don't think that it does. I think that we don't know how many people are currently infected, and as a result, people think we're seeing the serious cases.
Okay.
So I think that we
We
are
can all
good.
dial it down.
Mhm.
Yes, but not knowing, I think, is what.
That's what, it
What
is. It's
what
all about
feeds
the
the fear.
fear of the unknown, right? And so as we learn about the true disease progression, we're going to be able to calm down a little bit more. But right now, it is appropriate to take precautions
Mhm.
as we're learning more and more each day.
Yeah, I was going to leave that for you, Doctor. That does.
Sorry.
Because
No.
it was perfect.
It's a conversation.
We should be proactive. We should take precautions. I'm just wondering, have we gone overboard? I don't think so, but you're the expert. You tell me.
So the precautions are going to mirror what we're doing with influenza, which is the
Yep.
usual, the washing of the hands, the
Yep.
sneezing in your arm, not in your hands, being cautious, staying home if you're sick. So that follows the exact same pattern. I think maybe what you're leading to is everyone wearing masks in
We'll get to that.
addition to.
Yeah, there were a
So
lot of
we
questions
should-
regarding that.
Right,
So
I'm sure there are.
We'll talk about. Let's jump in. Lisette is a teacher, and she says, as a teacher, should we be concerned with the spread of the virus or exposure in classrooms? What is safe to use around children for disinfecting? So it's two questions there. Talk to me about teachers. Should they be concerned about exposure in the classroom setting?
So we're seeing less of this in children,
Okay.
actually. So it's more adults. But in terms of the disinfection, it's really the standard disinfection materials that we use are effective against this virus.
But not all kids are under the age of 10. Not all the students are under the age of 10. Spit it out, Joe. So some of them are in high school, some of them are 17 or 18. Same question, should there be a worry of the exposure?
Right. The good news is it's nothing new, right, in terms of the precautions. Wash your hands frequently and thoroughly. Use alcohol-based hand sanitizer. Make sure it's greater than 60% alcohol. So all of those standard precautions that we take for the influenza, as we talked about before, same kind of thing. It's not that all of a sudden we have to learn a new thing to do in terms of protecting ourselves from this virus.
I saw you shaking your head, Doctor. Yes, I mean, these are some of the kids are older. Whereas at 17, 18 years old.
I think Lisette is also hitting on congregate settings.
Yes.
So I think she's bringing up the point, should I be worried because now I have a classroom, a group that's coming together in close quarters? What if someone is ill? So we are understanding that coronavirus can be contagious. We're understanding that bringing people very close together, less than 3 feet, prolonged periods of time can spread.
Okay.
So that is a consideration, which goes back to if you have somebody who's ill, a child who's ill, stay home and then continue with the classes. But I think decisions are being made about classes and maybe holding things online for now while we're still understanding the spread.
What I was seeing in looking at some of screening the questions before you arrived was there were many questions that focused on work, people going to work. And Petra Rodriguez writes, can someone catch it on the job site? I guess it depends on the job site. If they work in another part of the floor. So it sounds like she might be in a building. So and we have many buildings in New York. So if there's a problem on the 19th floor, should I be worried if I'm on the 14th floor?
So this is a virus that we believe is spread by droplets. So the distance is 6 feet, and then there needs to be some version of prolonged contact. Exactly what that is, you'll hear people using the numbers of 2 minutes or 4 minutes or 5 minutes, but somebody that's on the other side of this room is not going to be affected if you're sitting here and you're sick.
Okay, so that should answer her question. She should be a little bit safer if she's 10 floors removed from where there might be a problem.
Yes.
There was another one moving down the line.
So can I go
Yes,
back
go ahead,
to Petra's
please.
point? So I think Petra's point goes back to what we technically describe as airborne versus droplet,
Yes.
right? So if we can go back for a minute, because we have a lot of questions around that.
Well, there's one here that
So we
sort
can
of goes.
combine it?
Yes. No,
So-
we're free fall.
Excellent. So airborne are things like tuberculosis, like measles, where with measles, you can be in a room where the patient left hours ago, But the droplets are not droplets. The droplet nuclei, they're so tiny.
Yeah.
They're still floating. So you can catch measles and the person is long gone. That is different. That's airborne. Droplet.
Yes.
They're big, heavy. When you sneeze, sorry to say, they all come out
Yes.
and they go plop. So they're not going to go floating down the room into another room, or the patient leaves, somebody else comes in, and they're going to suddenly catch it. They're big, they're heavy, they drop. That's why, as Marta said, you need that 3 to 6 foot and for a prolonged period of time. So you can work on an office next to that person, but you should not get the droplets unless you come into the office, touch the things the sick person is touching.
Well, I can almost hear the follow-up question being, if the sneeze happens and there are droplets on the table, on the subway pole, how long can those droplets be there and be exposed to it?
Yeah, we were just talking about
Yes,
this
we
earlier.
were.
We were, you know, typically if you look at how other viruses act, we're talking minutes to hours. We're not talking days, weeks, or months where you're worried that somebody was on a subway a week ago and now, you know, you have to, they're already going to disinfect the subways, right?
Yes.
But you're not going to be worried that, you know, the virus is staying alive on surfaces for days.
Okay. I get back to the student sneezing on their desk.
Right.
How long does it stay on the desk? Okay. Which is why the desks are probably cleaned and the schools are probably
Right. The
cleaned.
virus likes to live in human beings. It's not particularly a fan of living on a surface. It dies.
One doctor yesterday told me it's very different, the length of that droplet survival, if you're in a sauna as opposed to if you're in a classroom setting. So do conditions vary the number, if you will, in terms of survivability of droplets?
I mean, that's an interesting point. I guess that what they're talking about is humidity in the air
Yeah.
Right.
and moisture in the air. I don't know about that. Do you, either of you?
Not around coronavirus, but other infections, if you keep whatever secretions it's in very moist, it'll live longer.
Yeah.
If the secretions dry off, it dies off. But around this, I don't think they've described it to that degree.
Well, perhaps that's one of the reasons why we had a couple of questions come in from people wondering about weather and what impact it will have on coronavirus. So Adriana Scortino and Dana Peloso sent in the exact same question. Will warm weather kill the virus? You first.
So that comes from influenza and the flu season. I think we don't know about coronavirus. We are hopeful. And I think that that's what you're hearing when
Yeah.
you hear people talk about the end of the, you know, this going away when the weather warms up.
Okay.
And coronavirus in general is one of the most common viruses that causes the common cold. So if it acts like any of its brothers or sisters or cousins, then the viruses tend to thrive in colder environments. And so it is likely, but we don't know for sure, that the warmer weather will bring resolution to this virus.
Shira writing in, is it true that COVID-19 won't survive in hot and humid weather? Same thing. We don't know for sure.
So
Here-
we're seeing
Go ahead.
it in countries with warm climates,
Yeah.
right? So right now, you wouldn't have thought we would see rising numbers in Egypt. We saw that
Iran.
small outbreak in Israel. In Iran, we're seeing the very large numbers. So those are parts of the world where right now the temperatures are warmer than they are here and in China. So I don't know that that warm weather holds as much. I think what we are looking towards is the activity and the infection rate to die down because more people are going outdoors. They're not in these congregate setting inside as much. They're going outdoors. The activity may drop down a bit, which will give us hopefully a chance for some of the newer treatment and research studies to get some results. So maybe by the fall, if there's an increase in numbers again, we may be better equipped if we have other things to help us.
Sounds to me, and tell me if I'm...
Hopeful thinking? You think too much?
No.
I'm a positive person.
But it sounds to me like the message there is don't put your guard down just because
100% no.
just because we've hit June or July on the calendar.
That's right.
You know, keep acting and then as you are doing now. Will the pneumonia vaccine help you? And this is interesting because my mom and dad just recently got the pneumonia vaccine, which I didn't even know there was one, but they said you should get the pneumonia vaccine.
We'll have to counsel you off.
Okay, well, we'll here's the opportunity, and hopefully mom and dad are watching.
So the pneumonia vaccine is against a specific bacteria called Streptococcus pneumoniae. So other than by you not being sick with another respiratory infection, that SARS-CoV-2 would make you sicker.
Okay.
Other than that, it would not have a direct impact on COVID-19.
So the answer is no, Mom and Dad.
But it was good that they got the vaccine.
Yes, it was good that they got the vaccine
Yes.
for their own purposes. But let's continue with that thought, because this was driven home yesterday, and I've heard this over and over. Go get the flu shot.
Right.
Yes?
It's the same thing. So if you have pneumonia or you have the flu, you are more susceptible to developing COVID-19. And so everybody should have the flu shot. Anybody with a chronic illness or anyone over the age of 50 should have the pneumonia shot.
Yes.
Right? Because that is the best thing that we can do to protect ourselves against infections in general. So those things are really important to do.
All right. I want to do 2 minutes. Yes, thank you. I want to go back a little bit to what we were just discussing, because this was a specific question from a gentleman named Andy Herr, and he was getting what he thought are conflicting messages. Andy says, during yesterday's update by Mayor de Blasio, he stated and emphasized the coronavirus could only be spread by fluid exchange. But during the 5 p.m. broadcast yesterday on our channel, one of the doctors answering about subway safety concerns stated that it could be spread up to 6 feet away. So which is it? They don't sound mutually exclusive.
Yeah, I think we might need to clarify. So when we're talking about droplets, I hate to be so graphic, but it's little tiny pieces of saliva, so wet things that are carrying virus in them. So they're not mutually exclusive, right? So it's sort of your saliva, your mucus coming out and spreading on things.
But if you're 20 feet away, the concern isn't as great as if you're 4 feet away.
That's right. And also, as Marta said, if you read the CDC guidelines, WHO, it's close and prolonged contact.
Okay.
So the two should be together.
All right, we're going to take a little break and give a shutdown here on Facebook. And then we're going to have a quick spot on Eyewitness News coming up here in just a few minutes. So Facebookers, don't go away. We'll be back in a little while. asthma question, people with asthma. A good Channel 7 traditionally has been good in the boroughs, BB&Q, Brooklyn, Bronx, and Queens.
High
And
asthma.
of course, you know that Harlem and the Bronx have high levels of asthma.
Can we do 30 seconds? All right, 30, we're good with audio. Yeah, we'll go 51. Great.
Meryl? Yeah. Tell Chuck that just to change it up a little bit, I'll start with Dr. Serrano and work this way.
Serrano first. Okay, I don't think Chuck's using Zoom, it's only on TV. 8,
Okay.
7, 6, 5, 4, 3.
Hello, Facebookers. Thanks for tuning in once again here for our second hour of questions and answers regarding the coronavirus. And joining us today, 3 fabulous doctors who've done a fantastic job of answering so many of your questions already. Starting from here, Dr. Marta Feldmesser is with us. She's from Lenox Hill. She's a specialist in infectious disease. Dr. Tanya Elliott in the middle here, allergy and immunology, her specialty, and Dr. Serrano Siegel-Mora, also infectious disease. Let me start with you, Doctor, on the end. A lot of the questions that came in were age-related, if you will. Let me just read you one. We can maybe tackle a few of those from a woman by the name of Georgine Stoner. And she says, they keep talking, maybe doctors, I don't know. They keep talking about people over the age of 60. I am in that age group, but I am healthy. I work out, I eat right. Why would I consider myself to be in that risk group?
So, Georgina, that's a very good question. Number one, as people get older, the immune system changes, even if they're still feeling healthy. And frequently, there's more other diseases, such as heart disease, lung disease, and all that, that does make the body older, even though on the outside we're feeling great, but on the inside, the immune system is not as good.
My metabolism isn't what it used to be. I'm 73 years old, says Mary Overton, and taking meds for AFib, atrial fibrillation, thank you. But otherwise, I'm in excellent health. If I take all of these precautions that we've talked about, how vulnerable am I?
So, you know, as we just discussed, right, we have age as an independent risk factor, and then each time you have a chronic illness, it sort of stacks the deck a little bit more. So I would say for her age and a history of a heart condition, slightly higher risk than somebody who was younger than that and didn't have that heart condition. But the good news is she's taking her medications as appropriate. Sounds like she's otherwise feeling good and healthy. And so, you know, the same standard precautions would apply to her.
Well, let me ask you, since you're the allergy specialist here, we had a lot of questions come in from people who either suffer allergies or have asthma. So both Christine Falcone and Annette White, what if you have allergic asthma and bad allergies? Are you more susceptible?
Sure. So this coronavirus impacts the lungs mainly. So it's a disease of the lower airways. And so with individuals who have asthma, right, that puts them at a much higher risk, and any pulmonary disease for that matter, but asthma for sure. And so when you have asthma, you have inflammation of your airways. Now, enter coronavirus, you have additional inflammation of your airways, and it can just sort of cause this very impactful immune response that can tackle your lungs and then cause pneumonia. So most important thing for people with asthma, making sure that they're staying on their maintenance medications every day. If they start to have asthma symptoms more than a couple of times a week, that's the time to phone your doctor because you might need some adjustments to your medicines. If you're on your medicines, though, you should be in good shape.
But at the same time, Dr. Martin, I'll send it over to you. What are the precautions that those very people should be taking? Or should they be on a higher level than everyone else simply because of the conditions that they already have?
So that's a very good point.
Should they stay inside, I guess is my bottom line.
So they should do the social distancing. Those are the people for whom I think it's more important to stay out of large crowds because they are at higher risk. And so it's a time to take a step back and just take some extra precautions.
Okay.
But
let me ask, go ahead. You
I would just say, and staying on your medications, right? That sort of levels the playing field, right? If you have a chronic condition, but it's well controlled and you're staying on your medications, then you're in better shape. And then, again, making sure you adhere to those standard precautions, the hand washing we've been talking about, not going out in large public places, but keeping on your medicines and seeking medical care when you become symptomatic to prevent an asthma attack. Those are the most important things you can do.
You know, you mentioned symptomatic. There was somebody who asked, what's the order of the symptoms? Say I do get it. I am infected. What would I be seeing first, next, and at what level do I need to pick up the phone and call the doctor?
So that's a great question. For most people, it presents as a common cold. So they're probably going to start with feeling fatigued. We call that a prodrome. That kind of sort of, you feel like you're coming down with something.
Malaise.
Malaise. You feel fatigued, you feel down, you don't really feel like eating, you're tired, muscle achy. Then the fevers, the cough, the sore throat, all of that can come together, or the fever, sore throat, then cough. Once shortness of breath sets in, high fevers, feeling terrible, that's sort of the danger zone where people should seek medical help, right? So for most people, if they're having the runny nose, the cough, the sore throat, wait it out, make sure you're well hydrated, Tylenol if you have fever, stay away from others, including people in your household. You don't want to spread to others. Once you start having continued high fevers, cough, chest pain, shortness of breath, that's when, as Tanya said, you're talking about the risk for that lower lung disease as opposed to the upper infection. That could be dangerous. That's when you pick up the phone, you call your medical provider, who may say for you to go to the hospital, but not just to go to the hospital.
Well, I was
Always
going to shift it over to you,
contact.
to Dr. Marta. I mean, what's the difference between me picking up the phone and me going to visit the ER or me visiting my general practitioner? Where's the barrier, the line?
Sure. So really, we want people who are mildly symptomatic, and it's the shortness of breath is really the key indicator. People to stay home. We don't want you going to your doctor's office. Your doctor's office doesn't want you there because you don't want to expose the people in the office. And same thing goes with the emergency rooms. It's when you really are starting to feel more severely ill that the place to go is really the emergency room.
Okay, and severely ill, define severely ill, again, keep it simple.
Again, high fever, shortness of breath.
Okay.
But I'll add another thing, because I think it's important to seek care, and we're on a Facebook Live right now. We're adopting technology,
I was just going to mention
right?
that to you.
So there are virtual visits that you can do. So I think it's appropriate to seek care, but that doesn't necessarily mean getting in your car and driving to a doctor's office where you're at risk of either coming into contact with other sick people or perhaps spreading the disease. So doing a virtual visit, covered by most commercial insurances now, co-pays are being waived, so you should check with your insurance companies. And you can do almost like a FaceTime with your doctor, HIPAA compliant, meaning that you don't have to worry that your information is going to be hacked or anything like that. And the doctor can do a face-to-face video visit with you. They can observe your respiratory rate. They can have you go and take a thermometer and check your temperature, and then guide you regarding next steps.
So then you're accomplishing two things. You visited the doctor while at the same time kept the doctor safe from whatever conditions that you might have.
And also not overburdening the emergency rooms, right? Because the emergency rooms have a hard time dealing with many, many, many people. And if people are not as ill as others, you're going to wait longer. And it's just really going to increase your dissatisfaction, and their ability to take care of you is limited.
Let's stay on that vein, because we did get a bunch of questions that came in from people who are medical practitioners, if you will. Millie Drummond asks, my husband works in a New York hospital, and I suffer from lung disease, diabetes, and high blood pressure. How do I protect myself? You first. She's married to someone who works in a hospital.
So that's a tough one.
And she has underlying conditions of lung disease, diabetes, and high blood pressure. Oof, tough.
It is tough. So there are precautions that people can take. I mean, I wouldn't necessarily assume that all healthcare workers have already had exposure.
Okay.
But if, let's say, the husband were to have exposure, then you would say to separate in the home, perhaps sleep in a separate bedroom if possible, not share a bathroom, not share towels, etc., and to sort of distance.
Yep. I love you, honey, but.
Right.
Yes.
Now's not the time.
Now's not the time, and we have to stay our separate ways. So that's a great question, Millie. If you're out there, thank you so much. Lizabella Stephanie, she's in Port Washington, out on Long Island. I have major surgery on my back this Thursday. I'm a little nervous about being in the hospital for up to a week. Should I be?
You know, I think it's a matter of if you're doing elective surgeries or if it's something urgent. If it's an elective surgery, you may want to opt to postpone it. You know, why put yourself at risk. That being said, hospitals are taking, we're all on faculty at major academic centers and hospitals. They're taking significant precautions, right? They have the masks, they're hoarding all the disinfectants, right? So you should rest assured that there are proper protocols in place, and they're certainly going to keep sick people very separate from people that are undergoing, going to the emergency room. Also, the operating room. Operating rooms are the most sterile place that you could be.
Safe place to be.
Exactly.
And also, I think the one point, to her point, in case she's worried about hospitals in general, we've been doing this preparedness for what's going on now.
We being?
The hospitals, and myself as an infection control person, and my other half job at the hospital, making sure that we control infections.
Yes.
So we've been doing this pretty much since we started hearing about what's going on overseas, because we are all a global village, everyone's traveling, so at some point you might see something. So we started doing this 3 months ago. So this was not a week ago, not a few weeks ago. This has already been ongoing. So we've thought about all of these things. But as Tanya says, if it's an elective procedure and it can wait a little bit. But if it's not, we have current procedures ongoing in all our operating rooms.
You'll be safe.
Business as usual.
Business as usual. A lot of people try and work out to stay healthy. We had a few questions come in. This one from Doreen Calandra, very similar to others. I want to know about going to the gym. Should I avoid it? Is the gym a breeding ground? You got people that are sweating. You got people holding onto the gear. You get off it, then she gets on it, and then is the gym troublesome?
So
you're getting the tough ones, aren't you?
She's next to you to get the hot seat.
Well, you guys can help her out, okay?
I'm happy here.
So I would say that, again, you have to be careful. And a lot of, I think what I would say to people more is that what you want is for people to be considerate of others. When you get a cough, you start having symptoms, please stay home, okay? But any setting that you go to where there are a lot of people congregating around, it is higher risk.
Yes. So you are putting yourself in a quote-unquote hot zone, if you will.
And you have to wipe everything down.
Well, I was going to say, don't wipe just at the end. Maybe wipe before you get on.
100%. Even if you just saw somebody wipe it down, why not wipe it down one more time?
Yep.
Can I say something, the converse of that?
Please
How
do.
about if you are ill, please don't exercise?
Okay.
If you are ill, you should rest and hydrate and listen to your body, because you already have the stress of the infection. So now you are adding the stress of exercise, the raised heart rate and all that. You might already be a little dehydrated just from being sick.
Okay.
And now you're just setting yourself back.
I do think, though, from a gym perspective, this is now the time to check with your gym and see what protocols they have in place, and also make sure that all of the disinfectant products that they're using are EPA certified. So you're well within your rights to make sure that those wipes that you're pulling are the appropriate wipes. You know that they're taking the appropriate measures in terms of having cleaning crews coming in. I understand that people want to continue to work out, and we don't want people to panic. We want people to enjoy the things that, their everyday activities. But it is completely appropriate to make sure that you check with your gym around their protocols and things that they're using.
At the same time, the doctors who were here yesterday, and piggyback off this, if you will, said this virus is easy to clean.
Standard precautions, right? Wash your hands. Wash your hands frequently. It's all the stuff we learned in grade school, right? Wash your hands frequently and thoroughly. Bring hand sanitizer that has 60% alcohol or higher. Make sure that the disinfectant wipes being used are EPA certified to kill off viruses and bacteria, right? Those are the precautions that you can take. So we're not asking you to do anything new. Standard precautions, but stick to them.
You know what would be fabulous is if long after this is over, people keep washing their hands the way they should be.
For joy.
Yes,
that would
which
be
is
nice.
just so nice. Let's talk about something that we have visually seen, particularly here in New York City and on the subways. Masks. Should you be wearing a mask? There was Bernadette, here we go. Bernadette Conrad from Brooklyn. Why aren't they at least having us walk around with medical masks? I know it doesn't prevent it, but it prevents the spread. Clear up the...
So one of the points here is that masks can be very misleading in terms of you think you're protecting yourself when you really aren't.
Are not.
the lifespan of the general surgical procedure masks is really only a few hours. Then moisture collects inside and can become a breeding ground.
Yes.
And also, people are generally not trained in the use of the masks. So you'll see people take the masks and put them under their chin, touch the front of the mask, which is where the droplet nuclei would be. Okay. And so really, you have the potential to actually contaminate yourself more.
Are we at the point where people hoarding masks means the people who really need them are having trouble getting them, and those people would be you guys?
Right, so they're appropriate for use in a healthcare setting. So imagine that surgeon who's doing a procedure, right? They should be wearing a mask to protect, the transmission there for if they sneeze onto somebody, or you're going in and you're evaluating somebody who's sick. That's the appropriate circumstance. But to your point around just walking around Manhattan wearing it all day, you could be putting yourself at increased risk and creating a breeding ground for virus if you're wearing it inappropriately and incorrectly and for too long a period of time.
Are you tempted walking around and when you see people with masks saying, that's not helping you?
I'd like to take it off. The other thing is people will cover their mouth and not their nose because it's hard to breathe through them, so that's not effective. And the last thing I want to say is I think they're extrapolating from us seeing patients who are coughing, are sick. We will put masks on a sick person so that they don't spread to others.
Yes.
So there is a rationale for that, and it works. But just to put on a mask when you leave the house to protect from this, no. I think people are also thinking around the world where there's a lot of pollution. It's a normal thing when you're in Hong Kong, when you are in various parts of Southeast Asia, to put on a mask when you leave the house. The air quality is very bad.
Very bad.
That's right. So I think they're extrapolating from, I put on a mask for that and I wear it for 12 hours, so it'll protect me from this, and that's not the right thinking.
And if there are people in the know, the way you are, and you see someone wearing a mask, the impression might be that they think you're sick because you're wearing it to protect others. And if you're sick, you shouldn't be out, by the way.
That's right.
Okay, all righty. There was a question here that I had. It was really good. Let's cut down to the basics here in New York City. Is it safe to go to restaurants? Can it be transferred through food? Let me start down there because I don't want you to get all
I want her to get that one. I want her to get that one.
Okay.
I can do that one. Okay, so...
I mean, we've seen it in Chinatown. We've seen it in other places where there's a high Asian population and the restaurants are empty. So there's this inherent fear that, I can't go to the restaurants.
So I don't think it's from the food. The one thing that we do know is that there's that the virus can, with some frequency, be detected in stool.
Okay.
So there is the risk for what we call fecal oral transmission. So people not washing their hands.
Thank you.
To mouth, et cetera, and so that things can be contaminated in that way.
Okay.
But
yes.
I think maybe we get back. You brought up something very important, the stigma around this.
Yes.
Our hospital is right near downtown Flushing. We have an incredibly diverse, multi-ethnic community. And I physically go to work in the middle of this every day. We're walking up and down the street. And I think people have shied away. I've read about it. I've seen it on the news. They've shied away from going to a Chinese restaurant or using a nail salon or whatever that business is. And it should not have that kind of stigma. That is not appropriate. So I just wanted to piggyback onto that because you brought that up. And it's something that we're very sensitive to because of where our hospital is located, in addition to just being in a global village.
Dr. Tanya, there's a question here. What is the incubation period of when you contract the virus and before you start showing symptoms, and therefore you know you have it?
So unfortunately, we don't know the answer to this question because we're not testing asymptomatic people, nor are we going to, especially with the shortage of tests that we have. So what we do know is that people that aren't showing symptoms tend to be less likely to transmit the virus. So you're more likely to...
because that was good.
Yes, so people who are asymptomatic, so they're a carrier, right? You're carrying the coronavirus, you are less likely to transmit it to someone else. You're less likely to infect somebody else.
But you also don't know that you have it at that point.
That's right.
It could be double.
A bit of a catch-22, but what we do know is the more symptomatic you are, the more you're sneezing, the more likely you are to infect somebody else.
So there's a recent paper that came out. we think that the incubation period, the time to symptoms, is somewhere around 14 days. And I think everyone has heard about that because when there have been people with a known contact, those people have been quarantined for the 14 days. So we think that that's a reasonable amount of time. But there was a recent study that just came out that said possibly it could be 5 days of incubation. So as Tanya said, I think that the range is wide. It could be 5 days, it could be 14 days, but it's certainly not going to be 24, 48 hours. It's going to be a period of time.
You raised a word that we have heard a lot throughout this epidemic, if you will.
The Q word?
The Q word, quarantine. Would you kindly explain to the viewers the difference between quarantine and isolation?
Okay, so quarantine is when you are staying, usually at home in this case.
You're healthy.
You're healthy, and you're staying because you don't know whether or not you are infected with the virus, and so you're waiting through the incubation period, the potential incubation period, to see if you will develop symptoms.
Okay.
When somebody's symptomatic, they're put on isolation. And so then those are...
Or
right.
removed. Isolation removed.
Okay. So isolation. So if you're in isolation, you are sick. If you're in quarantine, you may not be sick.
You may not be
Correct.
sick.
We're waiting. Okay, there we go. When will it end? The shortest questions sometimes are the hardest ones to answer. We talked a little bit about the weather affecting this, but you can't say, oh, on such and such a date, it's over, right?
Right, it's tough to say. I mean, you know, we saw the first cases of the disease occur in China in December of 2019, and we're starting to see it wane now. So if that's sort of any, now they also really hunkered down in terms of their quarantine and all the precautions that they're taking place. We've been much more proactive about that. So, you know, it'll be tough to tell. Nobody has a crystal ball. I don't know if you guys have any other thoughts around, you know, the duration of how long we'll be in this.
You think we're still talking about this in September?
I think we are. I think from what we're seeing now is various parts of the world, right? Because it's just been declared a pandemic today, which means international involvement. So there are various parts of the world now that are seeing escalating numbers of cases. Right outside Milan, I saw that the newest numbers, they had an increase by more than 30% in the last day or two. So we don't know when that will stop, plateau, and then start coming down again. But then it could be the next country seeing that. So that's why today's announcement by the WHO really pulls together everyone in the world to try to come up with some way of battling this and doing things like quarantine, doing things like social distancing.
It's important to define the word pandemic because that sounds really scary. Pandemic just means geographic distribution, that it's popped up in enough places that we can now say this is worldwide. It doesn't have anything to do with severity of disease, so it's a really important distinction to make.
We've got about 2 minutes before we wrap up on this edition of our Facebook session, but let me start with you because you mentioned something before. Testing. In fact, Governor Cuomo, during his news conference today, pointed out the differences between testing in the United States and testing that's been going on in places like Korea or South Korea, and how dramatic it was. Can you clear up the confusion for people who might be wondering, why can't I just walk into an ER and say, I want to get tested?
Sure. So I think for all our viewers, we need to understand that we're just increasing our capacity. We're not where we want to be, and that just takes a little bit of time. The CDC wanted to get it just right. So that took a little bit of time. There was a little bit of a setback with some of the reagents. Those are the things that you use as part of the tests. So things had to go back one step. But now many people, departments of health, and some of the commercial laboratories are starting to increase their testing capability. So we would like to do everything the governor says. I think we should all be testing more, but not yet. We don't have the capacity.
Yeah, you can't offer what you don't have.
That's right. And also what we're trying to do from the healthcare perspective is to try to prioritize. So we have a limited resource for now. We hope to have more. But for now, we have most medical centers, and I know certainly all of you have prioritized the critically ill. So if you're going to intensive care unit, if you're hospitalized, if you have lots of diseases that we talked about, lung disease, you're elderly, and also if you have potentially exposed other people, large groups of other people, You get prioritized.
But if you're perfectly healthy, don't expect to walk into the ER and say, I want to get tested and
No,
think it's going to happen.
don't do it.
It's
Same
just not.
thing, yeah.
Don't do it.
Yeah, like with strep throat or something, if you say, oh, I have a stomach ache, we're not going to test you for strep throat.
Right.
If you have a stomach ache, we're not testing you for coronavirus.
Yeah.
So a little bit of around common sense and appropriate triage.
All right, we're going to take a break on Facebook. Thanks for staying with us. We're going to be on the Eyewitness News in a few minutes if you want to catch up with us there. And then we'll have another final Facebook session coming up right around the 6 o'clock hour. So we'll see you in a little while. until somebody else.
It has to be a WHO.
Yes. Okay. Designation.
They
Okay.
declare it.
But it sounds from the way you just described it, it would almost be the equivalent of like the governor of New York declaring a state of emergency. When you do that, it opens up opportunities to make things happen.
That's right.
Okay. 45. Okay, thank you.
Yeah, the scientific community was waiting.
Hello, hello, hello.
Audio is breaking up. Let's see.
Audio is breaking up, Rolando says. Bob just texted.
This is Joe's audio. Yeah, I can keep talking and you tell me if you can hear it clearly, but I think in my ear it sounds okay.
Okay, it's good again.
Okay.
All right, Rolando says it's good. So we're going in 10 seconds? All right, Joe, we're 10, 9, 8, 7, 6, 5, 4, 3.
Welcome back, Facebookers. Thanks for joining us here for this Q&A information session on the coronavirus, and the three doctors that we have with us today helping out to answer the questions, clear up the confusion. Dr. Marta Feldmesser, Dr. Tanya Elliott, Dr. Sarana Siegel-Mora. They have been fantastic in terms of addressing the many questions that you've had. This session is going to be a little bit shorter, so we're going to try to go rapid fire, if you will, through as many questions as we can answer. I'll throw them out there, and they can tackle them as they see fit. So once again, thank you, ladies. Where do we start? John wants to know, he lives on 205th Street here in the city. I had a heart attack in 2018. I hope you're feeling better, John. And I'm in good health. I've taken my flu shot, my pneumonia shot. If I do everything by the book, wash my hands, avoid the crowds, will I be more likely to catch COVID-19? Sounds like he'd be less likely with all the things that he's doing.
He's doing everything right.
And he's a role model.
You're a role model. Way to go,
Role
John.
model.
So that's fantastic. So I guess keep doing what he's doing, and,
Yes.
and more should do just like it.
And share with his friends to
Yes.
follow his example.
It doesn't mean to go jumping into crowds.
Don't do that.
But we had a few, this is real basic. Should people ride the subway? The mayor a couple of days ago, maybe it was yesterday, it's already becoming a blur to me, said if you can avoid riding the subway or crowded situations, do so. Are you at the point where you've altered your transportation schedule?
Well, I'm lucky. I walk to work.
Okay, well,
But
that's,
apart
you
from
are
that-
fortunate. Yes.
But apart from that, I'm not at that point yet.
Okay.
I really, I think the subway is okay.
You do, yes. The concern on subways is congregant, is that the word? Big crowds, right? And enclosed spaces. So can you understand the legitimacy or the worry that some people would have in terms of going?
Sure, I could understand that. And if you're sick, you shouldn't ride the subway. If you're perfectly healthy and feeling fine, I don't share the same concern that you should be avoiding the subway at all costs.
There you go.
Wash your hands if you're in the subway
Yeah.
before you decide to drink your coffee. So maybe you want to limit what you're going to eat and drink while you're riding the subway.
Okay.
So you don't touch the pole, then touch the food and put it in your mouth.
Okay.
Same thing goes with cell phones, where we were talking about earlier, where
man,
you
cell
don't
phones.
have your cell phones
Yeah.
out, right? They are harboring lots of viruses and bacteria in general, and so keep it in your pocket
Okay.
when you're in large crowds.
Can I clean you can clean your cell phone, right?
Yes.
And how often should you? Because it's, I mean, you're bringing it to your face.
You
so
should do
often.
it at least 2 times a day, and please don't bring your cell phone with you into the bathroom.
No.
I'm not just saying just you. I'm saying everybody.
Yes.
Don't bring
do
it with you into the
Okay.
bathroom.
Dr. Sarana, I have scleroderma. Is that how you say it?
Yes.
Scleroderma, and taking methotrexate injections, says Nancy. Should I be staying home until this passes?
So Nancy is what we call an immunocompromised host. What that means simply is her immune system is lower than others.
Okay.
So it could be easier for her to catch all sorts of illnesses. So definitely for Nancy, I would say stay away from large crowds. Be very good about washing your hands constantly. And if there are sick family members in your home, what we call social distancing, remove yourself to another room, use a different bathroom, try not to share cooking utensils, things like that.
Define social distancing for us
So-
for this
oh.
purpose. Any one of you? Go ahead.
Marta?
Well, so it's exactly what Serrano was talking about. It's keeping yourself away from large crowds or from people who are sick, or if you are sick, staying away from others.
You don't want to be antisocial, you just want to be responsible.
Exactly.
Shelley is wondering, she lives in the Bronx. I live in a large apartment building. Is it safe to do my laundry in the building's laundry room?
Yes, it's safe to do your laundry. Again, if you're sick, you should stay home. But there's nothing new here. Standard precautions, frequent hand washing, all the things that we were taught in grade school to prevent the spread of infections. Those are the same things that you should be doing every single day. The ideal is for you to be able to continue on with your activities of daily living, what you're used to doing, but taking those additional standard precautions.
Hi, says Beatrice. Thank you, Beatrice, for tuning in. If you come into contact with someone who is in quarantine, should you yourself go into quarantine?
Okay, so the answer to that is no. So someone who's in quarantine is not sick at that time. So if you are a contact, you need quarantine. If you are a contact of a contact, there's nothing to do.
The flu is much more serious than the coronavirus. Yes or no? In terms of,
So we don't know.
We don't know. Okay.
So it depends. So what people
it's
call
very
the
general. I'm
well,
sorry.
no. We'd love to correct you. This is why
Please
we're
do.
here. Please. So when you talk about the flu, it could be a common cold. It could be influenza.
Yes.
Or it could also cover this new COVID-19, which is a new viral infection, right? So influenza, that's why we always push the vaccine for everyone to take. It can be really serious. It can affect young children and babies. It can affect the elderly. And there's real mortality associated with it.
Okay, that's
for
where I'm at.
sure.
Yes.
The common cold, not a lot of mortality. So with COVID-19, I think what Marta started to answer, there is a range of mortality. Right?
Yes.
The people who are young and healthy will probably just have a cold. Those who are older with lots of other underlying diseases, maybe asthma, things like that, lung disease, emphysema, that's a different story.
I don't want to minimize the people who have passed away as a result of the coronavirus.
Absolutely not.
But
Could be serious.
Comparatively speaking, in terms of mortality numbers versus the flu is much higher, is it not?
There are a lot more cases of
Lot
the
more
flu,
cases
right?
of
A
the
lot
flu.
more
Okay.
active cases
Yes.
of the flu. We're talking, anywhere from 9 to 45 million is the estimate, and it's a very broad number because we can't know for sure, right, whether or not someone has it unless they've been tested. Same thing with coronavirus, but way more active cases of the flu than there are of coronavirus right now.
I only ask because people out on the street, banging me on the head saying, you guys should be talking more about the flu because the flu is really serious. And we don't discount that the flu is really serious.
Right.
We've had a lot of questions from people about their profession. We've answered a few of them. Susan O'Malley is here in the city. Should we be concerned about workers who handle our food? She says specifically, a butcher, handling meat or doing cooking. Does it kill the virus? What about cold cuts for sandwiches? You start.
So I think that, I'm not so worried about the food. I'm more worried about the hand hygiene of the people handling the food,
handling the
but
food.
not the food itself.
Okay, so when she says should we avoid eating cold cuts and cheeses? No.
No, I would say
But
no.
keep an eye on the person.
Right, and there's lots of other things that you could pick up. It's not that every day we say, oh, you might get salmonella from the butcher, right? But that is an active risk because it is a bacteria that has the fecal to oral transmission. We've shown that coronavirus could also have that similar mode of transmission, meaning from your feces to your hands and then you're touching food. That's why we've implemented those hand washing measures. So make sure your butcher washes their hands.
Okay. We've had many questions, and I've just put a few together here regarding people getting on an airplane. So let me throw this one to you, Dr. Serrano. Diana, in Old Bridge, New Jersey. All right. My husband and I are in our late 50s and have plans to travel to Florida at the end of the month. Should we go?
So good question, personal decision, number one. Number two, all airlines, as we've all read, have instituted increased cleaning procedures. And more importantly, everyone's worried about the air in a plane. Planes use a very special kind of air filter called a HEPA filter that takes in the tiniest little organisms and traps them. So
that's the good news.
So that's the good news. So air floating around is going to be good. And they're cleaning at the seats, but you're also sitting next to seat mates. So if anyone is within 2 seats of you that's possibly coughing, sneezing, you are at increased risk.
So
if the plane is empty, you could move somewhere else. If the plane is full, that is a possible risk.
Okay. Diana, I hope that helps you.
Complicated answer.
Yeah, a personal decision. Do you want to put yourself in the plane, but the filters
With
work,
lots of people.
but you don't know who you're going to be sitting next to.
That's exactly right.
Okay. How safe is it to fly out now? What are the risks? I think we just covered that. That question came in from
And also,
Merrill
I think it
in
depends where
Plainview.
you're flying to.
Okay.
If you
Take it a
have to
step
be
further.
careful where you're flying to, there are increased cases that we're finding in other places. So you might be going to a place like a cruise.
Yes.
And now we understand we need to be a little bit more cautious. So be careful where you're going to.
Okay.
Don't go to a big convention.
I don't know any if you are pet owners, or specifically dogs. She's nodding her head yes. Diane from Brooklyn wants to know, I have a service dog, and I was harassed and discriminated against at Brooklyn Civil Court. They said dogs can transmit coronavirus to people.
That has never been proven. That really has not been demonstrated. There are, for people who are on who are ill and at home, people are asked to not pet their dogs, not feed their dogs, but it's not because it's been shown that animals can transmit it to humans.
Okay.
It's more that if you are sick and you sneeze on your dog, right? We talk about how coronavirus can live on surfaces, not for a very long period of time, but for a few hours or so, right? And then someone goes and pets that dog that you've just sneezed on, there's a chance of transmission from that perspective. The same thing with surfaces.
And dogs, depending on the kind of dog you have, they're very
Not as cute as mine.
They
I'm
can
going to
be
say
very-
that one more
They
time.
love to give kisses, you know.
They do. So dogs can have all sorts of different parasites and bacterial infections, so be careful with the kissing.
We've got about 30 seconds left. What if you're a dog owner and you have diabetes, you have asthma, you have, should you get someone to care for your dog? Is there anyone that falls into that category?
Wash your hands after you pet your dog.
That's it? Yeah, and you should be okay. All right. Good stuff, ladies. Thank you. We're done with our Facebook. Thank you guys for all the questions that you've sent in. They've been so fantastic. We hope we'd answered a few. We've got one more little hit that we're going to do on the news. That's coming up at 6 o'clock. But for Facebook, we're done for now. Again, thank you. Thank you all. There you go. This camera, Joe. Thank you all for sending us great questions. We hope we answered them and we cleared up a little bit of the confusion for you. We'll see you next time.
kills it.
disinfectant.
Right.
I'm being facetious.
Joe, mic check, please.
Mic check. My wife went to the liquor store. She said it's unbelievable. The people, no lie, people worried about coronavirus going to buy alcohol. Yes.
I was being facetious. Okay. I wouldn't think that people would do such things, but okay. I should joke then.
Heavy drinking can
prevent coronavirus.
Thank you. $200,000 tests in Korea, so that's what he's talking about.
Yeah.
Who's texting me?
It's probably your landscaper. You didn't let him know what to do.
That's when we usually start our watch.
Is Northville going to offer this commercially for everyone? No.
All right,
for the
stand
city.
by, everybody.
Whoops.
What happened?
Oh, goodness.
Here we go. And straight from the doctors, so you know you're getting facts and good answers to medical questions. We've got a limited amount of time, so let's throw at them 2 questions that we got from viewers. We'll work our way down the line. The first one that came in, should I avoid at this time non-emergency doctor's appointments? And this individual, Dwight, he says, I'm diabetic and have heart disease.
So this is a time where you may want to think twice about actually physically going to a doctor's office if you have significant comorbid conditions, other medical problems. But that doesn't mean you should avoid having medical care. And there may be other ways to do it.
Okay.
Right, and it's very important. If you have diabetes and heart disease, this puts you at higher risk for getting the coronavirus. So alternative ways to seek care, do a telemedicine visit with your doctor where you can do a video consultation. Make sure you stay on your medications.
That way you see the doctor and the doctor stays safe. Doctor, for you, I want to know about going to the gym. Should I avoid it? That's a great question.
So don't avoid the gym. Use common sense. Wipe all your equipment down. Avoid large settings where people are one on top of the other, but absolutely keep getting good health and exercise.
Might be a good idea to wipe before you get on as well as after you get off.
Absolutely.
So, all right, good
And
stuff
wash
there.
your hands.
Wash your hands.
Wash your
Can't say that
hands.
enough. Bill, we'll send it back to you, but remind everyone at home, if you want to see more of the answers to the questions you provided, we have it on our Facebook page, ABC7NY. Bill? Fantastic.
Okay, guys.